Welcome to a journey through time, a gentle exploration of healing, belief, and the human body as our ancestors understood it. For the next few hours, we'll be wandering together through the world of ancient cures and medieval medicine. Not with judgment, but with curiosity. With wonder at how people, centuries ago, made sense of illness and health with the knowledge they had. You don't need to do anything right now. Just listen. Let your mind drift where it will. If you fall asleep, that's perfectly fine. That's what this is for. And if you stay awake, you'll learn something fascinating about how medicine, how healing, how our very understanding of the human body has evolved over centuries. Get comfortable. Settle into your pillow. Let your breathing slow. We're going back in time, to monasteries and apothecaries, to royal courts and village healers, to a world where medicine was part science, part philosophy, part faith, where the body was a landscape of balances and humours, and where every cure told a story about how people saw themselves and their place in the universe. Let's begin. The Medieval Medical Worldview. Imagine for a moment that you're sitting in a medieval physician's chamber. The year is perhaps 1350. Outside, the world is vastly different from ours, but in here, in this room, there are books. Precious books, some copied by hand from Greek and Roman masters who lived 1,000 years before even this moment. The physician across from you is learned, respected. He's studied at the universities of Salerno or Montpellier or Paris, and he's about to explain to you why you're ill. But he won't talk about bacteria. He won't mention viruses or infections as we understand them. Instead, he'll speak of balance, of humours, of the fundamental liquids that flow through your body and determine not just your health, but your very personality, your temperament, your essence as a human being. This is humoral theory. And for well over 1,000 years, it was the foundation, the bedrock, of nearly all medical understanding in the Western world. The theory itself came from the ancient Greeks, particularly from the writings attributed to Hippocrates and later systematized by Galen, a Roman physician whose influence stretched across centuries. These weren't foolish men. They were brilliant observers of the human body, working with the tools and knowledge available to them, trying to make sense of the patterns they saw. They proposed that the human body contained 4 essential fluids for humours: blood, phlegm, yellow bile, and black bile. Each of these humours had its own qualities, its own characteristics. Blood was hot and wet. Phlegm was cold and wet. Yellow bile was hot and dry. Black bile was cold and dry. And health, true health, came from these 4 humours existing in perfect balance within the body. Not equal amounts, necessarily, but the right proportion for each individual person at each particular time. When you were ill, according to this understanding, it meant your humours had fallen out of balance. Perhaps you had too much blood, making you feverish and flushed. Perhaps your phlegm had increased, leaving you cold and sluggish with a running nose and chest congestion. Perhaps yellow bile had accumulated, causing a fiery inflammation. Or black bile had gathered, bringing melancholy and darkness. The physician's job, then, was to restore balance, to diagnose which humour was in excess or deficiency, and to correct it. This is why the logic of medieval medicine often seems to work in opposites. If an illness was characterized as hot, you treated it with cooling remedies. If it was wet, you dried it out. If cold, you warmed it. The principle was simple, elegant even. Bring the body back to equilibrium by introducing the opposite quality of whatever was causing the imbalance. Let's sit with this idea for a moment, because it's not as foreign as it might first appear. Even today, we sometimes think this way without realizing it. When you have a fever, you might take a cool bath. When you're congested with cold, wet phlegm, You might drink hot tea or breathe steam. The medieval physician would nod approvingly. You're thinking in terms of balancing opposites, even if you explain it with different words, with different science. But medieval humoral theory went much deeper than just treating symptoms. It connected the body to the cosmos itself. The 4 humours corresponded to the 4 elements that people believed made up all matter in the universe. Blood corresponded to air, phlegm to water, yellow bile to fire, black bile to earth. Your body was a microcosm, a tiny universe, reflecting the greater universe outside. The humours also corresponded to the seasons. Blood increased naturally in spring, with all its warmth and moisture and new life. Yellow bile in summer's heat. Black bile in autumn's cool dryness. Phlegm in winter's cold and damp. This meant that your health changed with the seasons, and a good physician adjusted treatments based on the time of year. What worked in summer might be dangerous in winter. The body was not a static thing, but a dynamic system, constantly shifting with the rhythms of nature. And then there were the temperaments. This is where humoral theory became not just medical, but psychological, even spiritual. A person with an excess of blood was sanguine, optimistic, social, sometimes indulgent, ruddy-faced and warm. Too much phlegm made you phlegmatic, calm, perhaps, but also sluggish, unemotional, cold. Yellow bile in excess created the choleric personality, quick to anger, ambitious, fiery in temperament. And black bile brought melancholy, sadness, introspection, artistic sensitivity, but also depression and fear. You can see how this created a complete system for understanding human beings. Your health, your personality, your moods, your susceptibility to certain diseases, all flowed from the balance or imbalance of these 4 fundamental fluids. A medieval physician, diagnosing a patient, would observe everything. The color of the skin and eyes, the texture of the tongue, the quality of the pulse, not just its speed but its strength, its rhythm, its character. The appearance of urine, which was examined with tremendous care, its color and clarity and sediment all providing clues. Even the patient's dreams might offer diagnostic information. All of these signs pointed toward which humor was causing the problem. And once the diagnosis was made, treatment followed logically from the theory. If you had too much blood, the physician might recommend bloodletting, removing the excess through cutting a vein or applying leeches. This wasn't barbaric to medieval thinking. It was logical, rational, scientific, even within their framework. You had too much of something, so you removed some of it. If you had excess phlegm, you might be given expectorants to help you cough it up, or emetics to make you vomit it out, purging the body of the problematic humor. Yellow bile might be reduced through bitter herbs, or through purging downward with laxatives. Black bile, the most mysterious and troublesome of the humours, might require special treatments, dietary changes, gentle herbs, sometimes careful purging, sometimes just time and rest. But treatment wasn't only about removing excess. It was also about adjusting qualities. Diet was tremendously important. Every food had its own humoral qualities. Meat was generally hot and moist. Fish was cold and moist. Vegetables varied. Lettuce was cold and wet, onions hot and dry. A skilled physician would prescribe specific foods to counterbalance a patient's condition. Spices and herbs each had their place in this system too. Ginger was hot and dry, useful for cold, wet conditions. Rose water was cool, good for hot inflammations. Mint could aid digestion by warming and drying. The medieval apothecary was a place of hundreds of substances, each catalogued by its humoral qualities, each ready to be compounded into the precise remedy needed. Even your activities and environment mattered. Exercise heated and dried the body. Sleep cooled and moistened. A hot bath had different effects than a cold one. Fresh air versus stuffy rooms. Emotional states could influence your humours too. Anger increased yellow bile. Fear increased black bile. Joy increased blood. Everything was connected. Everything had meaning within this elegant, comprehensive system. Now, here's what's fascinating. This wasn't just some peasant superstition or folk belief. This was the sophisticated, academic medicine taught at the great universities of medieval Europe. The most educated physicians in the most advanced hospitals of their time, in Baghdad, in Cordoba, in Cairo, in Paris, all worked within this framework. Islamic physicians, inheriting Greek medical texts and expanding on them brilliantly, refined humoral theory further. They wrote encyclopedic medical texts that were used for centuries. Physicians like Avicenna and Rhazes were giants of medieval medicine, and they too understood the body through the lens of the four humours. The theory persisted because, in many ways, it worked. Not in the way we understand medicine working today, but it provided a framework that allowed physicians to observe patients carefully, to think systematically about symptoms, to prescribe treatments that sometimes helped. And when treatments didn't help, the theory could explain why. Perhaps the diagnosis was slightly wrong. Perhaps the patient's individual balance was unusual. Perhaps the stars were unfavorable. For yes, astrology too played its role, but that's a story for another time. The humoral theory gave medieval medicine its internal logic, its coherence. And once you understand this, once you grasp that medieval physicians were trying to restore balance, trying to work with the body's natural systems as they understood them, then everything else begins to make sense. The strange ingredients, the timing of treatments, the careful attention to diet and season and emotion. It all flows from this central idea, that the body contains four humours, that health is balance, and that the physician's art is to observe imbalance and gently, or sometimes not so gently, restore harmony. As you drift off to sleep tonight, perhaps you can imagine yourself as a medieval person might have, as a being of blood and phlegm and bile, connected to the seasons, to the elements, to the great turning of the cosmos itself. A small universe seeking balance. Rest now. Let your humours settle into their natural rhythm. Let balance come. Diagnosing disease. Reading the body for clues. The medieval physician stands before you, and in his hands, a flask. A clear glass vessel, elegant in its simplicity, filled with your urine. He holds it up to the light streaming through the window, turns it slowly, observes the colour with the concentration of an artist examining a painting. He notes the clarity. Is it transparent like spring water, or cloudy, or thick with sediment? He may bring it close to his nose, inhaling carefully. And yes, he may even taste it. Just a small amount on the tip of his tongue. This is uroscopy, the examination of urine. And for centuries, it was one of the most important diagnostic tools a physician possessed. To our modern sensibilities, this might seem strange, primitive even, but let's sit with it for a moment. Let's understand what the medieval physician saw when he looked at that flask. He wasn't just looking at waste. He was looking at a window into the body's internal workings. A liquid message sent from the hidden chambers of your organs, carrying information about the balance of your humours, the state of your digestion, the heat or coldness of your liver and kidneys. Urine, in medieval medical theory, was processed blood. The kidneys refined blood, separating out impurities and excess moisture. So examining urine meant examining what your body was trying to expel, what it deemed unbalanced, excessive, wrong. The physician had been trained in this art. He'd studied detailed charts, beautiful, complex diagrams that showed dozens of different urine colors and what each might mean. These charts existed in medical texts across Europe and the Islamic world, refined over centuries of observation. Pale, almost clear urine might indicate a cold, wet imbalance. Too much phlegm. Weak digestion. The body unable to properly cook and process its fluids. The patient might be advised warming foods, drying herbs, perhaps gentle exercise to heat the constitution. Dark urine, amber or even reddish-brown, suggested heat. Too much blood, or perhaps yellow bile. The body burning too hot, consuming its fluids. Treatment might involve cooling foods, cucumber, lettuce, barley water. Perhaps bloodletting to remove the excess heat along with the blood itself. Cloudy urine, thick with sediment, indicated undigested material. The body struggling to process food properly. The liver perhaps not cooking the chyle. The milky fluid formed from digestion into proper blood. Remedies would focus on strengthening digestion, on herbs that aided the liver's concoction. But it wasn't just color. The physician observed layers and textures within the flask. Sometimes urine would separate into distinct regions as it settled. Clear on top, cloudy in the middle, sediment at the bottom. Each layer told part of the story. The top represented the head and upper body. The middle, the organs of digestion. The bottom, the lower body, the bladder and reproductive organs. Tiny particles floating in the urine. Were they like bran, like sand, like small clouds? Each texture had meaning. Oily films on the surface. Foam that persisted or quickly disappeared. Threads of mucus. Small flecks that might indicate the beginnings of stones forming in the kidneys. The smell too carried information. Sweet urine might indicate diabetes, though they didn't call it that. They noticed the honey-sweet smell and the excessive thirst that accompanied it. Foul-smelling urine suggested putrefaction, decay somewhere in the body's systems. Sharp, acrid smells indicated heat and bile. And yes, taste. This seems most shocking to us now, but remember, the medieval physician had few tools beyond his own senses. No blood tests, no x-rays, no instruments to peer inside the body. His eyes, his nose, his palate, these were his laboratory. A sweet taste confirmed what sweet smell suggested. A bitter taste indicated yellow bile. A salty taste might point to phlegm. The physician took only the smallest amount, just enough to register on the tongue, and he'd learned through years of training to interpret what he tasted. What's remarkable is that a skilled physician could supposedly diagnose a patient without ever meeting them face to face. A servant might bring a flask of the patient's urine to the physician's chamber. The physician would examine it thoroughly, ask a few questions about the patient's symptoms and habits, consult his charts, and prescribe treatment. This practice became so prestigious that some physicians rarely did anything else. They became specialists in uroscopy, their reputations built on their ability to diagnose from urine alone. Wealthy patients would send their urine to famous physicians in distant cities. Of course, this also opened the door to charlatans. Fake physicians who claimed to diagnose from urine, but were really just guessing, telling people what they wanted to hear, prescribing harmless or useless remedies. The medical texts of the time contain warnings about such frauds, evidence that even then, people understood the difference between genuine skill and pretense. But the legitimate practice of uroscopy was based on careful observation and a sophisticated theoretical framework. The physician was looking for patterns, comparing what he saw to thousands of cases he'd studied or treated before. He was, in his own way, being empirical, basing conclusions on observable evidence, even if his interpretation of that evidence was filtered through humoral theory. Now, let's imagine the physician has examined your urine. He's considered the evidence. But before he prescribes treatment, he does something else. He looks up, not at you, but at the sky, because the timing of treatment mattered enormously. And that timing was determined, in part, by the stars. Medieval medicine existed within a cosmos that was alive with influence and meaning. The planets moved through the heavens in their spheres, each one radiating specific qualities down to Earth. The moon waxed and waned, pulling on the fluids of the body, just as it pulled on the tides of the sea. The zodiac constellations wheeled overhead, each one governing different parts of the human form. This wasn't superstition separate from medicine. It was integrated into medical theory itself. The cosmos and the body were connected, and a wise physician worked with celestial rhythms rather than against them. The moon was especially important. Physicians observed that the moon's phases affected the humours, particularly the watery, phlegmatic humours that waxed and waned with lunar cycles. Bloodletting was considered more effective at certain phases of the moon. Too close to the full moon, and the blood might flow too freely, too much. During the waning moon, the blood was less abundant, and bleeding might not remove enough of the excess humour. Each month was governed by a zodiac sign, and each sign ruled over specific parts of the body. This knowledge was often displayed in what we now call the zodiac man, or anatomical man. Beautiful illustrations showing a human figure with zodiac symbols mapped onto different body parts. Aries the ram governed the head and face. Taurus the bull, the neck and throat. Gemini the twins, the arms and shoulders. Cancer the crab, the chest and stomach. Leo the lion, the heart and upper back. Virgo, the digestive organs. Libra, the lower back and kidneys. Scorpio, the reproductive organs. Sagittarius, the thighs. Capricorn, the knees. Aquarius, the lower legs. Pisces, the feet. When the moon passed through a particular zodiac sign, that sign's influence over its corresponding body part was strengthened. And this is where it gets interesting and careful. Surgery or bloodletting on a body part was considered dangerous when the moon was in that part's governing sign. The area would be too full of lunar influence, too engorged with fluid, too susceptible to excessive bleeding or poor healing. So if you needed surgery on your leg, the physician would wait until the moon had moved out of Aquarius or Capricorn. If you needed bleeding from the arm, best to wait until the moon was no longer in Gemini. The timing had to be right. This meant that sometimes treatment was delayed, not from negligence or ignorance, but from careful consideration of cosmic timing. A physician might tell a patient, "We'll perform the procedure in 5 days, when the moon enters a more favorable sign." And the patient would understand, would accept this, because everyone, educated or not, lived within this cosmological framework. The planets too had their influences. Saturn was cold and dry, bringing melancholy and black bile. Jupiter was warm and moist, temperate and beneficial. Mars was hot and dry, inflammatory and dangerous. Venus was warm and moist, gentle. Mercury was changeable, adaptable. The sun radiated heat and vital force. The moon, as we've discussed, governed moisture and flux. A physician might consult astronomical tables, or even cast a horoscope for the patient, not to predict the future, but to understand the celestial influences operating on the person's body at the moment of their illness. Were malevolent planets in positions of influence? Was Saturn throwing its cold, dark shadow over the patient's chart? This might explain an excess of black bile, a melancholic condition. Treatment could be timed to work with beneficial planetary influences. If Venus was well positioned, that might be an auspicious time for treatments involving warmth and moisture. If Mars was dominant, cooling remedies would be especially important. Some physicians were more invested in this astrological dimension than others. Medical astrology was a specialized field of study. But even physicians who didn't practice astrology themselves would be aware of basic lunar phases and zodiac positions. It was part of the general knowledge of the educated person in medieval times. Think about what this meant for the patient experience. You're ill. You visit a physician, or the physician visits you. He examines your urine with great care, asks detailed questions about your symptoms, your diet, your habits. He considers your age, your natural temperament, the season, the weather. And then he might say, your urine shows an excess of heat and yellow bile. Your pulse confirms this. But the moon is in Leo now, affecting the heart, and Mars is in a difficult position. We'll begin with cooling foods and gentle herbs immediately, but I'll wait 4 days to perform the bloodletting, when the celestial influences are more favorable. To the medieval patient, this made perfect sense. The physician wasn't just treating symptoms. He was considering the whole person, embedded in a particular moment in time and space, subject to earthly and heavenly influences alike. The delay wasn't procrastination. It was prudence. It was wisdom. It was understanding that there were forces at work larger than the individual body, and that healing worked best when it flowed with those forces rather than against them. Of course, in emergencies, treatment couldn't wait for favorable stars. A wound that wouldn't stop bleeding, a sudden crisis, these demanded immediate action. The physicians understood this. The astrological timing was ideal, but it wasn't absolute. Life and death took precedence. But for chronic conditions, for planned procedures, for treatments that could be scheduled, the stars were consulted. The charts were checked. The timing was chosen with care. Modern medicine would say this is nonsense. That the position of planets millions of miles away cannot possibly affect whether a surgery succeeds or a treatment works. And from our current scientific understanding, this is true. But consider what this practice actually did. It forced physicians to be patient, to observe their patients over time rather than rushing to immediate intervention, to consider the timing of treatment carefully, to recognize that the same treatment might have different effects under different circumstances. Sometimes the delay itself helped. The body's own healing processes had time to work. The acute crisis passed. The patient rested, changed their diet as instructed, and improved naturally before the planned procedure even occurred. The astrological framework, even if wrong in its cosmology, created a practice pattern that sometimes served patients well. Patience, observation, careful timing. These aren't bad principles for medicine, even if the reasons given for them were based on incorrect theories about planetary influences. And the uroscopy, the careful examination of urine, while it couldn't diagnose disease the way modern tests can, it did train physicians to observe carefully, to look for patterns, to compare and categorize, to be systematic in their approach. These medieval diagnostic methods, strange as they seem, were attempts to be scientific within the understanding of the time, to gather evidence, to interpret signs, to make reasoned decisions about treatment. The physician standing before you with that flask of urine, consulting his charts of colors and textures, checking his astronomical tables. He's trying to help you. He's using every tool and technique his education provided. He believes in what he's doing. And sometimes, not always, but sometimes, he actually does help. Rest now. Imagine yourself in that physician's chamber, the light streaming through colored glass, the flask held up to catch the sun. Diagnosis proceeding slowly, thoughtfully, with attention to details we've long since ceased to notice. Sleep. The stars will overhead, indifferent perhaps to our theories, but beautiful nonetheless. Standard medical interventions, draining the bad stuff. The diagnosis has been made. Your urine has been examined, the stars consulted, your symptoms carefully considered. The physician has determined that you suffer from an excess. Too much blood, perhaps, making you feverish and inflamed. Or stagnant blood, thick and sluggish, pooling in your legs and causing pain. The solution, to the medieval mind, was logical. Straightforward, even. If you have too much of something, remove it. This is where we encounter one of the most iconic and, to modern eyes, most disturbing aspects of medieval medicine. Bloodletting. The deliberate removal of blood from the body as a therapeutic intervention. For well over 2,000 years, from ancient Greece through the 19th century, bloodletting was one of the most common medical procedures performed. It was used for an astounding variety of conditions: fever, inflammation, headaches, gout, apoplexy, what we'd now call stroke, plague, consumption, madness, broken bones, childbirth complications. Almost any ailment could be treated, at least in part, with bloodletting. Because within humoral theory, most illnesses involved some kind of excess or corruption of blood. Let's be there in the room when it happens. Let's understand what this looked like, what it felt like, why people submitted to it, sometimes eagerly, believing it would cure them. The physician has several methods at his disposal. The choice depends on your condition, your constitution, the season, the position of the stars. The most direct method is venesection, cutting a vein. The physician has a small blade called a phleem or a lancet. It's sharp, designed for this specific purpose. He chooses the location carefully. Different veins for different ailments. For conditions of the head, headaches, eye problems, mental disturbances, he might open a vein in the forehead or behind the ears. For lung problems, a vein in the arm. For digestive issues, sometimes the veins of the foot or ankle. For hemorrhoids or reproductive complaints, blood might be taken from the ankle or behind the knee. There were detailed charts, just like the urine charts, showing which veins to open for which conditions. The median cubital vein in the inner elbow was popular, easily accessible, relatively safe, capable of producing a good flow of blood. This is the same spot where blood is drawn today for medical tests, though now we take only a small vial rather than letting it flow into a bowl. The physician makes his cut. Quick and decisive. The vein opens and blood begins to flow, not spurting, but streaming steadily into a bowl held beneath your arm. How much blood should be taken? This varied enormously. For a mild condition in a delicate person, perhaps just a few ounces. For a robust patient with a serious acute illness, sometimes a pint or more. In extreme cases, physicians would bleed until the patient fainted, believing that the fainting itself indicated that enough blood had been removed. The medical texts gave guidance, but ultimately it was a matter of judgment. The physician watched the blood flow, observed its color and consistency. Thick, dark blood might indicate that the worst of the corrupt humor was being expelled. When the blood began to flow bright red and clean, that might signal it was time to stop. The wound was then bandaged. The patient was told to rest, to take nourishing broths, to avoid exertion. The body needed time to recover, to regenerate the blood that had been taken. Some patients were bled regularly, seasonally. Spring was considered an especially good time for bloodletting, when the blood naturally increased with the warming weather. A preventive bleeding in spring might keep you healthy all year. It was like maintenance, keeping the humours balanced before they could fall too far into excess. Barbers, not just physicians, often performed bloodletting. The red and white striped barber pole you sometimes still see, that's a remnant of this practice. Red for blood, white for the bandages, the pole itself representing the stick patients would grip to make their veins stand out. But there was another method. Gentler, some said. more refined, less violent than the blade. Leeches. These small, dark, segmented worms, medical leeches, carefully cultivated and maintained, were applied directly to the skin. They would attach with their 3 jaws, each lined with tiny teeth, and begin to feed. A leech could consume several times its own body weight in blood. As it fed, it would swell, becoming engorged and sluggish. When full, it would detach naturally, or the physician would remove it, placing it in a basin of salt water to make it regurgitate the blood so it could be used again. Why leeches instead of cutting? Several reasons. First, leeches were believed to be more selective. They would remove the bad blood, the overheated, stagnant, corrupted blood, while leaving the good blood untouched. How they knew which was unclear, but this was the theory. The leech had an instinct for impurity. Second, leeches could be applied to sensitive areas where cutting would be dangerous or impractical. The gums, for instance, for toothaches or scurvy. Near the eyes for vision problems. On hemorrhoids. In places where precision was needed, and a blade might do too much damage. Third, the leech's saliva contained something that prevented blood from clotting. We now know this as Humoral, an anticoagulant, and it's still used in modern medicine. Medieval physicians didn't know the chemistry, but they knew the effect. The wound would continue to ooze blood even after the leech was removed, providing an extended, gentle bloodletting. Leeches were kept in special jars, fed regularly on animal blood, maintained as valuable medical tools. An apothecary or physician might have dozens of them. They were expensive. A good medical leech was worth caring for. The application was simple. Clean the skin. Place the leech. Wait. The leech would usually attach within moments, drawn by the warmth and the scent of blood. You'd feel a slight pinch as it bit. Not terribly painful, more of a tingling sensation. Then a gentle pulling as it began to feed. Patients often watched the leeches work, fascinated or repulsed or both. The creatures would pulse rhythmically, their bodies darkening as they filled. Sometimes multiple leeches would be applied at once, a whole cluster of them working away at removing the excess humour. After they were removed, the tiny wounds would continue bleeding for hours, sometimes longer. This was expected, even desired. The extended drainage was part of the treatment. Eventually the blood would clot, the wounds would heal, leaving tiny triangular scars where the leech's 3-part jaws had bitten. Now, here's where it gets both grimly practical and, yes, sometimes darkly humorous. The medical manuals that gave instructions for bloodletting were extraordinarily detailed, precise, and sometimes unintentionally amusing in their specificity. They would instruct the physician. For quotidian fever, open the basilic vein of the right arm on the first day, the cephalic vein of the left arm on the 3rd day, but only if the moon is waxing and not in a fire sign. Or, for melancholy with constipation, apply 4 leeches to the hemorrhoids and allow them to feed until satisfied, then apply a warming poultice of figs and honey. Or, for inflammation of the brain, bleed from the vein behind the ear, taking no more than 6 ounces unless the patient is robust and plethoric, in which case 12 ounces may be safely removed, provided Saturn is not afflicting the ascendant. The level of detail is remarkable. It shows how seriously this was taken, how systematized the practice had become. These weren't random stabbings. This was, within its own framework, a precise and regulated medical intervention. Some instructions acknowledged the risks. If the patient swoons during bleeding, lay them flat immediately and apply cold water to the face. If the bleeding cannot be stopped, apply pressure and a styptic powder of alum and egg white. Others were reassuring. Do not fear to bleed children, for they recover quickly. Even infants may be bled with benefit, using leeches for safety. Still others were optimistic, shall we say. For plague, bleed abundantly from the vein nearest the buboes, removing at least a pint of blood. This will draw the poison from the swelling and effect a cure. We know now that this didn't cure plague. That bleeding a plague patient, already weakened by infection, likely hastened their death rather than healing them. But the physician believed he was helping. The theory said that plague was caused by corrupt, poisonous blood, and removing that blood should remove the disease. And sometimes, bleeding did seem to help. A patient with dangerously high blood pressure might feel relief after bloodletting, as their blood volume decreased and the pressure dropped. A patient with polycythemia, abnormally high red blood cell counts, might genuinely benefit. In cases of certain types of heart failure, reducing blood volume could ease strain on the heart. These were rare circumstances. More often, bloodletting either did nothing or actively harmed the patient. But those cases where it seemed to work, those reinforced the belief in the practice. Confirmation bias, we'd call it now. The successes were remembered and celebrated. The failures were explained away. The patient was bled too little, or too late, or at the wrong phase of the moon, or the corruption was too deep. And here's something important to understand. Bloodletting often made patients feel different, which they interpreted as feeling better. The loss of blood volume would make you lightheaded, drowsy, weakened. If you'd come to the physician agitated and anxious, the post-bleeding weakness would calm you down. You'd rest, sleep. And rest and sleep are genuinely therapeutic for many conditions. If you'd come with a fever, the blood loss might make you feel cooler. Not because the fever was cured, but because you were now mildly in shock, your body trying to compensate for reduced blood volume. But you'd interpret this as the excess heat being drained away. The treatment working exactly as promised. The physician, watching you become calmer and sleepier and claiming to feel better, would have his practice confirmed. The bleeding worked. The theory held. It's easy, from our modern perspective, to mock this, to see it as barbaric and ignorant. But place yourself there. You're in pain, you're frightened, you're ill. You go to the most educated person available, someone who's studied for years, who has books and instruments and knowledge. They explain, rationally and confidently, that your illness is caused by an imbalance, and that removing the excess will restore you to health. They perform the procedure with care. They bandage you afterward, give you instructions for recovery, tell you what to eat and how to rest. And then, you do start to feel different. Maybe better, maybe just different, but you interpret it as improvement because you trust the physician and because you desperately want to get well. This is the human element of medicine. The hope, the trust, the placebo effect, yes, but also the genuine care that many physicians provided, the genuine belief they had in their methods. Bloodletting persisted for so long not because everyone was stupid, but because the theoretical framework supporting it was coherent, because it sometimes seemed to work, and because the alternatives were often worse or non-existent. Eventually, in the 19th century, as germ theory developed and medical science began to understand disease differently, bloodletting fell out of favor. Studies showed it didn't help, and often harmed. The practice faded away, remembered now as a symbol of medical ignorance. But those leeches? They're back. Modern medicine uses them again, in very specific circumstances. After reconstructive surgery, when blood flow needs to be encouraged in reattached tissue. After certain types of skin grafts. The leech's anticoagulant saliva, its gentle drainage of blood. These have legitimate medical applications after all. Not for balancing humours. Not for treating fever or plague or madness. But for specific, targeted purposes, based on modern understanding of physiology. The medieval physicians weren't entirely wrong about everything. They were observing real phenomena, real effects. They just explained them through a framework that we now know was incorrect. As you drift towards sleep, imagine the physician's chamber. The bowl slowly filling with dark red blood. The leeches, patient and industrious, performing their strange work. The absolute conviction that this would help, that balance would be restored, that health would return. Sometimes conviction itself is therapeutic. Sometimes the ritual of treatment, the attention of a healer, the belief that something is being done. These matter, even when the treatment itself doesn't work the way we think it does. Rest. Let your blood flow through you, uninterrupted, at its proper volume. Modern and fortunate in ways the medieval patient could never have imagined. Sleep now. No leeches tonight. Just soft pillows and quiet darkness. Extreme measures. When things got serious. Most illnesses were treated gently. Herbs and diet. Rest and purging. Bloodletting, yes, but controlled, measured. The physician working carefully within the bounds of humoral theory, adjusting balances, nudging the body back toward health. But sometimes the condition was severe. Desperate. The gentler methods had failed, or were clearly insufficient. The patient was in agony, or seizing, or mad, or dying from a head injury. And then the physician might recommend something far more dramatic, far more shocking, something that even today, knowing the procedure was real and documented, makes us pause in disbelief. He might recommend drilling a hole in your skull. Trepanation. Trepanation. The deliberate creation of an opening in the bone of the cranium. One of the oldest surgical procedures known to humanity, practiced for thousands of years across cultures all over the world. Let's be very clear about what this involved. This wasn't metaphorical. This wasn't symbolic. This was literal. Taking a tool, placing it against a person's skull, and cutting through the bone until the hard outer layer was breached and the delicate membranes covering the brain were exposed. Archaeological evidence shows us just how ancient this practice is. Skulls have been found with trepanation holes dating back 7,000 years or more. Neolithic skulls. Bronze Age skulls. Skulls from ancient Peru, from ancient Egypt, from ancient China, from Europe in every era. And here's what's most astonishing. Many of these skulls show signs of healing. Bone regrowth around the edges of the hole, smooth and rounded, indicating the person survived the procedure. Not just survived, but lived long enough afterward for the bone to begin knitting itself back together. Weeks, months, sometimes years. These weren't all deaths on the operating table. Many trepanation patients walked away from the procedure and continued living their lives, carrying a hole in their skull as evidence of their ordeal. Why would anyone do this? Why would a physician recommend it? Why would a patient consent? The reasons varied across time and culture, but by the medieval period, the logic was grounded in medical theory and practical observation. For head injuries, the reasoning was almost sensible. Not correct by modern standards, but sensible within what they could observe. If someone suffered a skull fracture, perhaps from a fall or a blow in battle, the bone might be broken or depressed, pressing inward on the brain. The person might lose consciousness, might have terrible headaches, might act strangely, or lose function in parts of their body. The physician could sometimes see the fracture, could feel the deformity in the skull. And he knew, from experience, that pressure on the brain caused problems. So the solution was to relieve that pressure, to remove the broken pieces of bone, to create space, to let the compressed brain expand back to its normal shape. In this context, trepanation was actually reasonable. Trauma surgery, removing damaged tissue, relieving pressure. Modern neurosurgery still does essentially this, though with better tools and understanding. But trepanation wasn't only performed for visible injuries. It was also used for invisible ailments. For seizures. For terrible, persistent headaches. For madness and melancholy. For conditions we'd now recognize as epilepsy, migraines, mental illness. The theory was that something inside the skull needed to be released. Pressure building up, perhaps from excess blood or corrupt humours pooling around the brain. Or vapors, bad air trapped inside, needing an escape route. Or, in some beliefs, evil spirits or demons lodged in the head, and the whole would give them a way out. This sounds absurd to us now. But think about how it must have seemed. A person who was healthy yesterday is suddenly having violent seizures today, their body convulsing beyond their control. Or they've developed blinding headaches that make them scream in agony. Or they've gone mad, hearing voices, seeing things that aren't there, becoming violent or catatonic. Something had clearly gone wrong inside their head. The skull was a sealed chamber, and something malevolent was trapped in there. Opening a hole, letting it out, this had a certain desperate logic. The procedure itself was terrifying. Let's not minimize that. There were no antibiotics. No anesthesia beyond perhaps some wine or opium or herbal sedatives, which would dull the pain but not eliminate it. No real understanding of sterile technique, though the better surgeons did clean their tools and wash the wound. The patient would be held down or restrained. The surgeon would mark the spot on the skull where the hole would be made, usually on the top or side of the head, avoiding major blood vessels if possible. Then came the cutting. Several methods existed. The scraping method involved using a sharp blade or scraper, working in circular motions, gradually abrading away the bone layer by layer. Slow, meticulous. The surgeon would scrape, pause, wipe away the bone dust and blood, scrape again, going deeper with each pass until finally the inner layer of bone grew thin enough that it could be carefully lifted away, exposing the dura mater, the tough membrane covering the brain. This method took time, perhaps an hour or more, but it was controlled. The surgeon could stop frequently, assess the depth, avoid cutting too deep and damaging the brain itself. The drilling method used a specialized tool called a trepan or trefine, a circular blade, like a small hollow cylinder with a sharp edge attached to a handle. The surgeon would position it against the skull and begin rotating it, drilling down through the bone. This was faster than scraping, but more dangerous. The drill could slip, could go too deep. The surgeon had to be experienced, had to know by feel when to stop, when the bone was about to give way. Some trepans had a center pin that pressed against the inside of the hole as it deepened, preventing the blade from suddenly plunging through when the bone was finally breached. A safety mechanism, crude but effective. There was also the boring method, using smaller drills to make several holes in a circle, then connecting them by cutting between them, finally lifting out the circular piece of bone, like removing a plug. All of these methods required steady hands, experience, and courage, both from the surgeon and the patient. The pain must have been extraordinary. The skull itself has no pain receptors, but the scalp certainly does, and the periosteum, the membrane covering the bone, is richly innervated. Cutting through these layers would have been agonizing. Many patients probably did pass out from pain or shock during the procedure. Perhaps this was a mercy. The surgeon could work more easily when the patient wasn't thrashing and screaming. Once the bone was breached, the surgeon would stop, would not cut into the brain itself, at least not intentionally. The dura mater, that protective membrane, would be left intact if possible. The hole was enough. The pressure released. The vapors escaped. The evil spirits driven out. The wound would be bandaged. Sometimes the circular piece of bone was set back in place, like a lid, hoping it would reattach. Sometimes it was left out, and the hole covered only with scalp and bandage, remaining open for the rest of the person's life. Recovery must have been brutal. The risk of infection was enormous. The skull exposed, the protective barrier broken. In an age before antibiotics, many patients must have died days or weeks later from infection, their brains swelling with pus, fever consuming them. But others survived. We know this from the archaeological evidence. Those healed skulls, with smooth bone regrowth, prove it beyond doubt. How many survived versus how many died? We can't know for certain. The skulls that ended up buried and preserved may not represent the full picture. Perhaps the procedure had a 50% survival rate. Perhaps better. Perhaps worse. What we do know is that it was performed regularly enough, over thousands of years, that surgeons became skilled at it. That techniques were refined. That patients consented to it despite the obvious risks. And occasionally, very occasionally, it might even have helped. The patient with a skull fracture and a piece of bone pressing on their brain. Removing that bone could save their life, could prevent brain damage. This is still done today in cases of severe head trauma. The medieval surgeon performing this was genuinely helping, even if he didn't understand the full anatomy or physiology involved. The patient with a subdural hematoma, blood pooling between the skull and brain after an injury, might get relief if the pressure was released, though the crude drainage of the time was far from ideal. For the other conditions, seizures, madness, chronic headaches, trepanation almost certainly didn't cure the underlying cause. You can't cure epilepsy by drilling a hole in the skull. Can't cure schizophrenia or depression that way. But the placebo effect in such a dramatic intervention must have been powerful. The patient believed the evil was being released. The family believed it. The surgeon believed it. And sometimes, in the aftermath, the patient did seem better, at least for a while. Perhaps the seizures happened to enter a natural remission period. Perhaps the headaches, cyclic in nature, were in a down phase. Perhaps the person's mental state improved simply because everyone around them now treated them as cured, expected them to be better, and that expectation itself was therapeutic. Or perhaps the trauma of the surgery, the weeks of painful recovery, simply distracted from the original complaint. Hard to worry about headaches when your skull is healing from being drilled open. The medical texts that describe trepanation did so with surprising matter-of-factness. They were surgical manuals, giving practical instructions. For head wounds with depressed bone, trepan to remove the fragments. For falling sickness, epilepsy, with fullness of the head, trepan to release the corrupted vapors. Mark the spot carefully. Use a sharp trepan. Work slowly. Do not penetrate the dura. Bandage well afterward. Give the patient strengthening broths and rest. Some texts included warnings. Do not trepan if the patient is already weak from loss of blood. Do not trepan during fever unless the cause is in the head itself. Do not trepan if the moon is in Aries, which governs the head, or if malefic planets afflict the chart. There were rules, precautions, acknowledgement of risks. This wasn't butchery. It was surgery, performed according to the best understanding of the time. Some surgeons became known for their skill with the trepan. They would travel from place to place, called upon for difficult cases. A child thrown from a horse, unconscious with a cracked skull. A soldier injured in battle, behaving strangely afterward. A woman with seizures that medicines couldn't control. The surgeon would arrive with his tools, would assess the patient, would explain the procedure to the family. And if they consented, and they often did, because what else could they do? He would perform the operation, sometimes in the patient's home. sometimes in a monastery infirmary or, later, in a hospital. The patient laid out on a table, assistants holding them steady, the surgeon making his prayers, to God, to Saint Luke the physician, to whatever powers might guide his hand and grant his patient mercy. Then the work would begin, the scraping or drilling, the blood and bone dust, the terrible vulnerability of the open skull, the careful bandaging afterward, the waiting to see if the patient would wake, would heal, would survive. And sometimes they did. Against all odds, in that world without modern medicine, without sterile operating rooms, without antibiotics or imaging or monitoring equipment. Sometimes they did. Those holes in ancient skulls, smooth-edged and healed, are testament to human resilience, to the body's remarkable ability to survive trauma, to the courage of patients who underwent this procedure and the skill of surgeons who performed it. They're also testament to how desperate people become when suffering is great enough, how willing we are to try even the most extreme interventions when pain or illness becomes unbearable. Trepanation continued, in various forms, well into the early modern period. The tools became more sophisticated. The understanding of anatomy improved. But the basic procedure, opening the skull to relieve pressure or treat disease, persisted. It wasn't until the development of modern neurosurgery, with anesthesia and antisepsis and antibiotics, that such procedures could be performed with reasonable safety. And even now, neurosurgeons still sometimes remove portions of skull to relieve pressure after traumatic brain injury, still create burr holes for drainage. The medieval trepaners weren't entirely wrong about everything. As you settle into sleep tonight, be grateful for your intact skull, for the absence of drills and scraping tools, for anesthesia and antibiotics, and all the things that make modern surgery survivable. Close your eyes. Feel the solid bone of your cranium, protecting that soft, precious brain inside. Whole, unbreached, safe. Sleep deeply. Dream peacefully. No surgeon stands over you with a trepan. No hole needs drilling. You are well. You are whole. Rest now in this modern mercy. Universal cures and luxury medicine. We've explored the logic of medieval medicine, the careful diagnosis, the systematic treatments, the desperate interventions when nothing else worked. But now let's talk about something different. Something that promised not just relief from one specific ailment, but protection from everything. From poison and plague, from venomous bites and corrupt air, from all the dangers that flesh is heir to. Let's talk about the medicines of the wealthy, the luxury cures, the substances so rare, so expensive, so exotic that only the richest could afford them. Medicines that were as much about status and power as they were about healing. Let's talk about Theriac, and about something even stranger, something that seems almost impossible to believe, but was absolutely real. Let's talk about mummy. Theriac, the universal antidote. If you were wealthy in the medieval world, if you were a king or a pope, a merchant prince or a powerful noble, you might keep in your private chambers a precious jar. Small perhaps, ornate, made of fine ceramic or even silver. And inside that jar, a thick, dark paste with a smell unlike anything else. Sweet and bitter and medicinal all at once. Complex. Ancient. This was Theriac, sometimes called Venice treacle or Theriaca, the universal antidote, the cure-all, the most famous medicine in the Western world for over 1500 years. And it was extraordinary, not because it worked, though people believed absolutely that it did, but because of what it was, what went into it, the sheer ambition of the thing. Theriac wasn't a simple remedy. It wasn't a tea made from one herb or a poultice of a few ingredients mixed together. No, Theriac was a masterwork, a pharmaceutical symphony. Some recipes called for 64 ingredients, others for 70, some for more than 100. Rare ingredients, expensive ingredients, ingredients from the far corners of the known world, brought along trade routes at enormous cost. Opium from distant poppies, myrrh and frankincense from Arabia, saffron, worth more than its weight in gold, cinnamon from Ceylon, ginger from India, rose petals, iris root, valerian, castor, cardamom, pepper, both black and long, anise, fennel, gentian, skink flesh, yes, the dried meat of a type of lizard, and the ingredient that gave Theriac its name, viper. Snake. Specifically, the flesh of vipers, prepared in a particular way. The recipe went back to ancient times, to Mithridates VI, king of Pontus, who in the 1st century before Christ supposedly took small doses of poisons regularly to build immunity. He created a compound, the Mithridatium, designed to protect against assassination by poison. Later, in the 1st century AD, the Roman physician Andromachus, serving Emperor Nero, refined the formula. He added viper flesh to the mixture, believing it had special properties against poison. The venom of the viper, properly prepared, would fight other venoms. Like curing like. The Theriac of Andromachus became legendary. Galen, that towering figure of ancient medicine, whose writings dominated medieval thought, wrote extensively about Theriac. He provided detailed instructions for its preparation. He vouched for its efficacy. And because Galen said it worked, medieval physicians believed him. The preparation of Theriac was an event, a ceremony almost. In major cities, Venice especially, which became famous for its Theriac production, the making of a new batch might be announced publicly, conducted in the open air, so people could witness that no fraud was being committed, that the ingredients were genuine, that the proportions were correct. The apothecaries would gather their ingredients, each one verified and displayed. The opium would be weighed precisely. The vipers, and they had to be the right kind of vipers, caught at the right season, would be killed and prepared according to ancient specifications. The vipers were beheaded and skinned, their organs removed. The flesh was boiled in water with dill and salt. Then it was dried and pounded into powder. This powder, along with the viper wine made from fermenting the creature's whole, would be incorporated into the mixture. All the dry ingredients would be ground and mixed. The wet ingredients, honey primarily, which served as the base and preservative, would be warmed. Everything combined in enormous mortars, ground and blended with pestles, stirred for hours until the consistency was perfect. The resulting paste would be thick, dark, fragrant with all those spices and herbs and strange animal substances. It would be packed into jars and sealed. And then it would wait, because Theriac had to age. Like wine, like cheese. The ingredients needed time to mature together, to blend their virtues, to achieve their full potency. Some recipes said Theriac should age for at least 6 months. Others insisted on a year. Some claimed that Theriac improved with age, becoming more powerful over years, or even decades. Jars of Theriac might be passed down as heirlooms, the aged paste inside considered more valuable than fresh batches. The belief was that during this aging process, the ingredients would ferment slightly, would transform, would develop properties they didn't have individually. The whole became greater than the sum of its parts. The universal antidote, capable of counteracting any poison, any venom, any corruption. How was it used? In tiny amounts. This wasn't something you ate by the spoonful. A dose might be the size of a pea, or even smaller, dissolved in wine or warm water and drunk, or sometimes just placed on the tongue to slowly dissolve. For poison, it was taken immediately upon suspicion of poisoning. The theory was that Theriac would neutralize the poison's effects, would draw the corruption out through sweat and other evacuations, would restore the humoral balance disrupted by the toxic substance. For plague, Theriac was taken preventively by those who could afford it. A small dose each day, believing it would protect them from the pestilential air, from the miasma that carried disease. For venomous bites, from snakes, scorpions, spiders, or rabid dogs, Theriac was applied both internally and externally, taken by mouth and also spread as a poultice on the wound itself. The viper in the medicine fighting the viper's venom. For general health maintenance, the wealthy might take it periodically, a dose each month perhaps, keeping the body fortified against whatever dangers might arise. And here's the thing. Theriac probably did make people feel something. The opium alone would have sedative and pain-relieving effects. Many of the spices and herbs had mild stimulant or digestive properties. The intense flavor, the warming sensation as it dissolved in wine, these created a physical experience that seemed like medicine working. If you believed you'd been poisoned and you took Theriac, the opium might calm your panic, might ease whatever stomach distress you were experiencing from fear or from whatever you'd actually eaten. You'd feel relief. You'd interpret that relief as the Theriac working, as the poison being neutralized. If you took it during plague time and didn't catch plague, well, most people didn't catch plague even during epidemics. But you'd credit the Theriac. Your dose of universal antidote had protected you. The belief in Theriac was so strong that it created its own evidence. People recovered from illnesses while taking it. They would have recovered anyway, but the Theriac got the credit. People avoided diseases while taking it. They would have avoided them anyway, but again, the credit went to the medicine. And because Theriac was so expensive, so prestigious, there was powerful motivated reasoning at work. If you'd spent a fortune on this substance, if you were a king who'd had it specially prepared and aged for years, you wanted it to work. You needed it to work, so you perceived it as working. Theriac became a status symbol as much as a medicine. Having Theriac, offering it to important guests, giving it as a diplomatic gift. These were displays of wealth and sophistication. Venice guarded its Theriac recipes jealously. Venetian Theriac, Theriaca Andromache Signoris Veneta, became the gold standard. Other cities tried to compete. Cairo had its Theriac, Constantinople, Paris, Bologna, but Venetian Theriac was considered the finest and commanded the highest prices. There were counterfeits, of course. Fake Theriac, made with cheaper ingredients, missing the opium or the viper flesh or other expensive components. The real thing was so costly that the incentive to counterfeit it was enormous. Authorities tried to regulate Theriac production. In some cities, apothecaries who were caught selling fake Theriac could be severely punished. The public preparations, witnessed by officials and physicians, were partly about preventing fraud, about ensuring that what was sold as Theriac actually contained what it claimed to contain. The practice of making and using Theriac continued well into the 18th century. Even as medicine began to change, as new ideas challenged old certainties, Theriac persisted. It was finally removed from official pharmacopoeias in the 1800s, declared obsolete and ineffective. The last commercial Theriac was supposedly produced in Venice in 1906. The end of a tradition stretching back nearly 2,000 years. Mumia, the medicine of the dead. But as strange as Theriac was, with its vipers and opium and 70 ingredients, there was something stranger still in the medieval pharmacy. Something that seems almost unbelievable until you see the documentation, read the accounts, examine the evidence. Medieval and Renaissance physicians prescribed something called mummy, ground-up human remains from ancient Egypt. Yes, people took bits of mummified human bodies as medicine. Knowingly, deliberately, on the advice of learned physicians. Let that settle in your mind for a moment as you lie there in the dark. Imagine opening a jar and inside, brown powder. Dark, resinous fragments. And knowing that this powder was once a person. Someone who lived and died thousands of years ago in Egypt, was carefully preserved, and has now been ground up and imported to be sold as medicine. How did this happen? How did consuming the dead become medical practice? The story begins with a misunderstanding, a linguistic confusion that had profound consequences. In ancient Persia and the Islamic world, there was a substance called mumia, a natural bitumen, a tar-like resin that seeped from rocks in certain mountainous regions. This natural mumia was believed to have medicinal properties, used for wounds, for broken bones, for various ailments. When Arab physicians encountered Egyptian mummies, they noticed that the preserved bodies were dark and resinous. The embalming materials, the resins and oils used in mummification, looked similar to natural mumia bitumen. They were dark, sticky, aromatic, so they made an assumption. They believed that the Egyptians had used natural mumia as part of their embalming process, that the bodies were soaked in this medicinal bitumen, and therefore the substance could be harvested from the mummies themselves. This wasn't entirely wrong. There were resins and plant materials in the embalming process, but it wasn't the same as natural mineral bitumen. It was a confusion of similar-looking substances. But the confusion led to a conclusion. If you couldn't get natural mumia from the mountains, you could get it from mummies. And in fact, mummy mumia might be even better, because it had been steeping in a human body for thousands of years, absorbing vital essences, preserving life force. This is where the medieval theory gets particularly strange. The belief developed that mummification had preserved something more than just the physical body, that in the careful ritual preservation of the corpse, something of the person's vital force, their essential energy, had been trapped and concentrated in the resinous wrappings and the dried flesh itself. And if you consumed that concentrated essence, if you took mummy powder into your body, that vital force could transfer to you, could strengthen you, could heal what was broken or weak. It was a kind of sympathetic magic blended with medical theory. The mummy had been preserved from decay for millennia. By consuming it, you would partake of that preservation, that resistance to corruption and death. By the medieval period, mumia had become a standard ingredient in European medicine. Apothecaries stocked it. Physicians prescribed it. Medical texts discuss proper dosing and applications. What was it used for? A remarkable range of conditions. Headaches. The powder would be mixed with liquid and drunk. The theory was that it strengthened the brain, prevented humours from rising to the head. Bleeding. Both internal and external. A wound that wouldn't stop bleeding might be treated with mummy powder, either applied directly or taken internally. The preservative properties of the mummy would supposedly help the blood coagulate, would stop the flow, bruises and contusions. The mummy powder mixed into an ointment and applied to the injury. The concentrated vital force would speed healing, would prevent the bruise from festering or the injury from becoming worse. Broken bones. Taken internally while the bone healed, believing it would strengthen the repair, would help the bone knit faster and stronger. General weakness and debility. As a tonic, a strengthener. If you were recovering from illness, or just felt depleted, a small dose of mummy might restore your vigor. Stomach ailments. Digestive problems. Even plague, in some prescriptions. Mummy was seen as a powerful, if expensive, general remedy. The doses were small. A pinch of powder, usually, dissolved in wine or water or honey, sometimes mixed with other medicines. You wouldn't consume large amounts, partly because it was expensive, partly because the strong medicinal substances were thought to be dangerous in excess. But where did all this mummy come from? Egypt had many ancient tombs, yes, but still, the demand in Europe was substantial. Apothecaries across the continent needed supplies. A trade developed. Mummy merchants, people who would go to Egypt, would open tombs or purchase bodies from local dealers, would extract the resinous material, or simply grind up bits of the mummified remains, and would ship it back to Europe. Sometimes they scraped the black resin from the surface of the wrappings. Sometimes they ground up the desiccated flesh itself. Sometimes they pulverized bones. It varied depending on the supplier and what the market would bear. And here's where it gets darker. The supply of ancient mummies, properly preserved thousands of years ago, was limited. But the demand was high and growing. So, suppliers became less scrupulous. Bodies that weren't truly ancient. Bodies preserved more recently, sometimes just a few decades or years old. Bodies that hadn't been carefully mummified, but had simply dried out in Egypt's climate. Bodies that were prepared specifically for the European medicine market, using crude methods to darken and preserve them artificially. There are accounts, grim, disturbing accounts, of bodies being acquired through questionable means. Executed criminals, the poor and unclaimed dead. Bodies dried in the sun or baked in ovens, treated with pitch and bitumen to darken them, to make them look like ancient mummies. The European buyers, far from Egypt, couldn't always tell the difference. They trusted their suppliers. Or they didn't care, as long as what they received looked right and could be sold as genuine mumia. By the 16th and 17th centuries, there were complaints. Physicians and apothecaries beginning to express doubts. Not about whether mummy worked as medicine. Many still believed it did. But about whether what they were getting was genuine. The French physician Ambrose Père wrote critically of the practice. He'd investigated the sources of mumia and was appalled by what he found. Bodies that were clearly not ancient. Fraudulent preparation methods. He argued against using mummy as medicine, calling it disgusting and ineffective. But others defended it. Wrote that genuine ancient mummy, properly prepared, was still valuable. That you just had to be careful about your sources. Buy only from reputable dealers. Verify the quality. The practice continued for a surprisingly long time. Mummy was still listed in some European pharmacopoeias into the 18th century. Still being imported, still being prescribed, still being consumed. Eventually, multiple factors led to its decline. Growing skepticism about its efficacy. Moral and religious objections to consuming human remains. The influence of newer medical theories that didn't support such practices. And eventually, Egyptian authorities restricting the export of antiquities, including mummies. By the 19th century, mumia had largely disappeared from medicine. It became a historical curiosity, a strange practice from a superstitious past. But think about what it represented. The lengths people would go to for healing. The desperation that would make consuming the powdered remains of the long dead seem reasonable. The trust placed in ancient authorities and exotic remedies. And think about the mummies themselves. People who lived 3,000 years ago, who were carefully prepared for an afterlife they believed in, who expected to remain undisturbed in their tombs for eternity. Instead, ground up and shipped across the Mediterranean to be sold by weight in apothecary shops. There's something profoundly unsettling about it. A violation that the original persons could never have imagined. Their preserved bodies, meant to house their souls in the afterlife, instead destroyed and consumed as medicine. Both Theriac and Mummy represent something important about luxury medicine in the medieval and early modern world. These weren't remedies for the common person. The poor couldn't afford viper-laced paste aged for years, couldn't purchase powdered mummy at apothecary prices. These were medicines of privilege, of wealth, of access to global trade networks that could bring ingredients from Egypt and India and Arabia. And they were medicines of belief. The more rare, the more exotic, the more expensive, the more powerful they must be, the more they must work. Because surely something so precious, so difficult to obtain, so steeped in ancient wisdom, surely it must have special properties. The wealthy person taking their tiny dose of Theriac, dissolving their pinch of mummy powder in wine, believed they were accessing the accumulated medical knowledge of millennia, believed they were protecting themselves in ways the poor could never afford. And in that belief, they found comfort, found confidence, found something that made the world seem a little less dangerous, a little more controllable. As you drift towards sleep now, you can be grateful. Grateful that medicine has moved beyond such things. That healing no longer requires viper flesh or human remains. That the cures available to you don't depend on wealth or trade in exotic substances. The dark paste in its ornate jar. The brown powder scraped from ancient tombs. These are history now. Strange practices from a stranger time. Rest easy. Let these stories of Theriac and mummy settle into your mind like old, odd dreams. Interesting but distant. Not threatening. Just peculiar chapters in the long, winding story of how humans have tried to heal themselves. Sleep now. No universal antidotes needed tonight. No concentrated life force from the long dead. Just rest. Just the body's own natural healing, happening quietly while you dream. Good night. Let the centuries fade. Let the apothecary's shop close its doors. Let the mummy merchants fade into history where they belong. Sleep. Magic, symbols, and sympathetic healing. We've talked about the logic of medieval medicine, the humours and their balance, the careful observations, the systematic theories. We've seen the extreme interventions, the trepanning, the bloodletting. We've explored the luxury remedies, the Theriac with its 70 ingredients, the mummy powder from ancient tombs. But now we're going to step into a different realm. A place where medicine and magic blur together, where the line between healing and enchantment becomes impossible to draw, where what you believed mattered as much as, perhaps more than, what you actually did. This is the world of sympathetic healing, of correspondences and symbols, of roots that looked like humans and weapons that carried wounds, of stones that held power and plants that screamed. Let's begin with a plant. A particular plant with a particular root. A root that grew in a shape that seemed impossibly, deliberately human. The mandrake. The mandrake root. Picture yourself walking through a medieval marketplace, past the vegetable sellers, the cloth merchants, the metalworkers. And then you come to the apothecary's stall. Among the jars of herbs and powders, the bottles of tinctures and oils, you see something that makes you stop. A root, but not like other roots. This one has a thick body, branching into what look like legs. Smaller protrusions that could be arms. A bulbous top that resembles, unmistakably, a human head. The mandrake root. Mandragora. One of the most famous, most feared, most valued plants in medieval medicine and magic. The mandrake grows wild in Mediterranean regions. Its leaves are broad and dark, spreading close to the ground. Its flowers are white or purple, bell-shaped and beautiful. Its fruit is sometimes called the devil's apple, golden and fragrant, but potentially dangerous to eat. But it's the root that captured the medieval imagination. Because when you pulled a mandrake from the earth, cleaned away the soil, you could see it. The resemblance. Some roots looked more human than others, but the best specimens, the most valued ones, they truly looked like tiny people. Male or female, depending on how the root had branched. And this resemblance was no accident, medieval thinkers believed. This was the doctrine of signatures. The idea that God, or nature, had marked certain plants to show what they were good for. A walnut, which looks like a brain, must be good for head ailments. Lungwort, with spotted leaves resembling diseased lungs, must treat lung problems. And mandrake, shaped like a human, must have power over the human body itself. But the mandrake was dangerous, not just medicinally, though it is genuinely toxic in the wrong doses, but supernaturally, magically. The most famous belief about mandrake was this: when you pulled it from the ground, it screamed. A terrible, unearthly shriek. And anyone who heard that scream would die, or go mad, or suffer terrible misfortune. This created a problem. How do you harvest a plant that kills anyone who harvests it? The solution, according to medieval law, was elaborate. You found a mandrake plant. You dug around it carefully, loosening the soil, but not pulling it up. Then, you tied a rope around the root, and the other end of the rope you tied to a dog. You plugged your own ears with wax. Sometimes you'd blow a horn, or make loud noises to drown out the coming scream. And then, you'd call the dog to you, or throw food to make it run toward you. The dog would pull the mandrake from the earth. The root would scream. The dog would die, a sacrifice necessary to obtain the precious root. But you, with your ears protected and your distance maintained, would survive. Would have your mandrake. Did people actually do this? The historical record is unclear. Some texts describe the process as if it were real practice. Others seem to treat it as folklore, legend, something that people said about mandrake, but didn't necessarily believe. What we do know is that mandrake root was expensive and highly valued. Whether or not the harvesting ritual was actually performed, the belief in the root's dangerous power made it seem more precious, more potent, and it was used, extensively, for multiple purposes. As medicine, mandrake was primarily employed as a sedative and anesthetic. The root contains tropane alkaloids, the same family of compounds found in plants like belladonna and henbane. These are genuinely psychoactive. They can cause drowsiness, reduce pain, induce visions, and in high doses can be deadly. Medieval physicians would prepare mandrake wine. The root soaked in wine for days or weeks, its alkaloids leaching into the liquid. A patient about to undergo surgery, perhaps an amputation or the removal of an arrow or the setting of a badly broken bone, would be given a cup of this mandrake wine to drink. They would become drowsy, confused, less aware of pain, not fully unconscious, perhaps, but sedated enough that the surgeon could work while the patient was somewhat dulled to the agony. This was as close as medieval medicine came to anesthesia, and it genuinely worked, at least partially. The mandrake wine did reduce consciousness and pain sensitivity. The dose had to be carefully judged. Too little, and the patient would still suffer terribly. Too much, and they might never wake up. But a skilled physician who knew his mandrake could provide real relief. Mandrake was also used for insomnia, for melancholy, for conditions we'd now recognize as anxiety or depression. A tiny dose, much smaller than the surgical dose, might calm the mind, ease troubled sleep, bring a dreamy peace. But beyond its medicinal use, mandrake was a magical object. The root itself, once obtained, was kept as a talisman, a charm. Wealthy people might have a mandrake root in their homes, carefully preserved, sometimes dressed in tiny clothes like a doll. It was believed to bring protection to the household, to increase fertility, to attract wealth, to guard against evil spirits and witchcraft. Some people slept with a mandrake root under their pillow, believing it would bring prophetic dreams. Others carried small pieces of the root as amulets, sewn into pouches and worn around the neck. The root had to be cared for. Fed, some said, with wine or milk poured over it regularly. Kept warm. Treated almost like a living thing or a preserved spirit. In return, it would use its power on your behalf. Was this medicine or magic? The medieval mind didn't draw a sharp distinction. The mandrake root healed through its physical properties, the alkaloids that sedated and calmed. But it also healed through its spiritual properties, its human shape connecting it to human bodies, its scream proving its otherworldly nature, its very strangeness marking it as powerful. Both aspects were real to medieval people. Both mattered. Both were part of how healing worked. The weapon salve. But mandrake, strange as it was, still involved treating the patient directly, giving them medicine, having them carry talismans. The treatment touched the person being healed. Now let me tell you about something even stranger. A healing method where the patient might never be touched at all. Imagine you've been wounded, stabbed perhaps in a fight, or shot with an arrow, or sliced by a sword in battle. The weapon has been removed from your body. Your wound is bleeding, painful, at terrible risk of infection and corruption. You go to a healer, and the healer asks you, not to see the wound, but to bring the weapon. The blade that cut you, the arrow that pierced you. Bring that, and I can heal you. This was the weapon salve, also called the powder of sympathy. One of the most peculiar healing practices in the medieval and early modern period. The theory was based on sympathetic magic, the idea that things which were once connected remain connected, even at a distance. The weapon that entered your flesh had touched your blood, had been intimately connected to your body at the moment of injury. That connection persisted. So if you wanted to heal the wound, you treated the weapon. You applied medicine to the blade, and through the sympathetic link, that medicine would affect the wound itself, no matter how far away the wounded person might be. The healer would take the weapon, the knife, the sword, the arrow. They would prepare a special ointment. Different recipes existed, but many included ingredients like moss gathered from a skull, bear fat, powdered earthworms, and human blood. All things associated with healing or with life and death. This ointment would be carefully applied to the weapon, spread along the blade where it had touched the wound. Sometimes the weapon would then be wrapped in cloth and kept warm, kept near a fire, as if nursing the injury itself. And the patient, they were told to keep their actual wound clean. Bandage it with clean cloth. Don't let it get dirty. But no medicine was applied to the wound directly. The healing was happening elsewhere, through the treated weapon. Sometimes it worked, or seemed to. The patient would report that when the weapon was treated, their pain eased. When it was kept warm, they felt warmth in the wound. When it was cleaned, the wound began to heal cleanly. We can understand now what was probably happening. The instruction to keep the wound clean and covered, to not apply the usual medieval poultices and treatments. This was actually good advice. Many of those poultices were filthy, full of bacteria, actively harmful. A wound left alone under clean bandages often healed better than one treated with contaminated substances. So the weapon salve worked, but not for the reasons people thought. It worked because it made patients leave their wounds alone, which was better than the alternative treatments available. But to medieval and Renaissance practitioners, this confirmed the theory. The sympathetic connection was real. The weapon carried the injury's essence, and treating the weapon treated the injury. Some versions of the practice got even more elaborate. The weapon would be treated at specific times, according to astrological calculations. Special words would be spoken over it, prayers or incantations. The healer might divine which ingredients to use based on the nature of the wound and the patient's horoscope. It became fashionable, particularly in the 16th and 17th centuries. Nobles wounded in duels would have their swords treated with weapon salve. Soldiers injured in battle would send their arrows or musket balls to healers who specialized in sympathetic treatment. There were debates among learned physicians. Some defended the practice, offering complex theories about magnetic emanations and spiritual connections. Others denounced it as superstition, insisting that medicine must touch the patient to work. But the practice persisted because people believed they saw results, and because there was something appealing about it, something almost gentle. You didn't have to endure painful treatments applied directly to your wound. The healing happened elsewhere, mysteriously, while you rested and waited. The weapon salve represents something important about medieval healing. The belief that the world was full of hidden connections, that things influenced each other in ways beyond the obvious and physical, that healing could work through symbols and sympathies, through correspondences that linked distant objects. This wasn't stupidity. It was a different way of understanding how reality operated. A worldview where everything was connected, where spiritual and material weren't separate categories, where the right knowledge of these hidden connections could give you power over disease and injury. Gemstone medicine. And if weapons could carry wounds, if plants shaped like humans had power over human bodies, then surely precious stones, formed deep in the earth over countless ages, must also hold power, must be able to transfer their qualities to those who possess them. Gemstone medicine. Precious and semi-precious stones, used not just as ornaments, but as healing tools. This practice went back to ancient times and continued well into the modern era. Different stones for different purposes, each one believed to carry specific virtues, specific powers. Rubies, red as blood, were associated with the heart and with life force itself. Wearing a ruby was thought to strengthen the heart, improve circulation, prevent bleeding. Some texts recommended grinding a ruby into powder and consuming it mixed with wine for these purposes. Though given the expense of rubies, this was only for the extremely wealthy. More commonly, the ruby would be worn, set in a ring or pendant, kept in contact with the skin. The stone's virtue would radiate into the body, providing continuous subtle healing. Emeralds, green and cool, were for the eyes and for vision. The green color, restful and soothing, would strengthen sight, prevent eye diseases, even improve memory and mental clarity, since the eyes were believed to be closely connected to the brain. An emerald worn around the neck, or in a ring, would protect your vision. Looking at an emerald regularly, letting your eyes rest on its green surface, was therapeutic in itself. Some physicians recommended that scholars and scribes, who strained their eyes with constant reading and writing, should keep emeralds nearby to gaze at periodically. Sapphires, blue and celestial, were associated with heaven and with spiritual protection. They would guard against poison, against plague, against evil influences. A sapphire ring could be dipped in wine before drinking, transferring the stone's protective virtue to the liquid, making it safe. Pearls, formed in the sea by oysters, were linked to purity and to the lunar, watery aspects of the body. They were used for issues of the blood and humours. Ground pearl powder, mixed into medicines, was believed to strengthen the body, calm the mind, and promote longevity. In Chinese medicine, pearl powder has been used for thousands of years and continues to be used today, though the claimed benefits don't align with modern scientific understanding. Diamonds, the hardest substance known, would transfer their strength and invincibility to the wearer. Protection in battle, resistance to disease, fortitude of spirit. A diamond amulet was the ultimate protective charm, if you could afford one. Amethyst, purple and beautiful, prevented drunkenness. Its very name comes from the Greek amethystos, meaning not intoxicated. A cup carved from amethyst, or amethyst set in the rim of a drinking vessel, would let you drink wine without becoming drunk. Or at least, so it was believed. Coral, organic rather than mineral, but classified with gemstones, protected children. Coral beads were given to infants to teeth on, believed to ease the pain of teething and protect against illness. Coral amulets hung around children's necks would guard them through the vulnerable early years of life. Jet, fossilized would turn to stone, black and smooth, was for mourning and melancholy. It absorbed grief, drew out sorrow. Widows would wear jet jewelry, and it was thought to ease their suffering, to help them carry their loss. Each stone had its planet, its element, its humoral qualities. Physicians would sometimes prescribe specific gemstones based on a patient's horoscope, determining which stone would best balance their particular constitution and current ailment. And yes, sometimes these stones were ground into powder and consumed. A practice that seems wasteful and bizarre to modern eyes, destroying a precious gem to make medicine. But if you believed the stone's virtue resided in its essential nature, in the substance itself, rather than the beautiful shape, then powdering it would release that virtue more completely. The powder would be mixed with liquids and drunk, or made into pills with honey or other binders, or included in compound medicines along with herbs and other ingredients. For those who couldn't afford to consume actual gemstones, there were compromises. You could rent a gemstone from an apothecary, pay to keep it for a period of time, wear it for healing, then return it. Or you could purchase water that had had gemstones soaking in it, the virtue partially transferred to the liquid. There were also attempts at fraud, of course. Glass passed off as emerald, colored quartz sold as ruby. Physicians and medical texts warned about this, gave tests to verify genuine stones. Hold it to flame and see how it reflects light. Test its hardness. Check its weight. The real stone would behave differently than the counterfeit. The belief in gemstone medicine lasted remarkably long. Well into the 18th and even 19th centuries, you could find medical texts recommending certain stones for certain conditions. The practice faded gradually as medicine became more scientific, as the understanding of disease changed, as gemstones came to be seen as valuable for beauty and rarity rather than for therapeutic virtue. But think about what this practice represented. The belief that the earth itself produced healing substances, that beauty and healing were connected, that the same stones which pleased the eye could also strengthen the body, that nature had provided, in these crystalline formations, concentrated essences of planetary and elemental powers. And think about the comfort it might provide. If you were sick and frightened, and someone gave you a beautiful stone to wear, told you it would protect you, would heal you, the beauty itself might be therapeutic. The weight of it around your neck, the knowledge that you were doing something, that you had this powerful object on your side. The placebo effect with gemstones must have been substantial, not because the stones had actual medicinal properties, but because believing in them, treasuring them, feeling their presence, these psychological factors could influence how you experienced illness, how your body responded, how you coped with fear and pain. All of these practices, the mandrake root with its scream, the weapon salve with its distant healing, the gemstones with their transferred virtues, they show us a world where healing was understood differently, where the boundaries between medicine and magic were porous, where what you believed, what you imagined, what you hoped, these weren't separate from physical healing but integral to it. Modern medicine has largely abandoned such ideas. We understand disease, through biology and chemistry. We know that treating a weapon doesn't heal the wound it caused. That wearing a ruby doesn't strengthen your heart in any measurable way. That mandrake roots don't actually scream. But we've lost something too, perhaps. The sense of living in a world full of hidden connections and meanings. Where a root shaped like a human was a message from nature. Where the beauty of a gem wasn't just aesthetic, but therapeutic. Where healing could happen through invisible links of sympathy and correspondence. Medieval people lived in a more enchanted world than we do. A stranger world. A more frightening world in many ways, but also a more meaningful one, where everything signified, everything connected, everything mattered. As you drift towards sleep, you can let yourself imagine that world for a moment, where stones have virtues and plants have spirits, where the weapon remembers the wound, where shapes and symbols carry power. It's comforting, in its way, the idea that healing is everywhere, in roots and stones and invisible connections, that the universe is full of remedies, if only you know how to find them, how to use them. Rest now. No mandrake scream will wake you. No weapon needs treating on your behalf. No gem required for your protection. Just sleep. Simple, natural, free. The body healing itself the way it knows how, without magic, without symbols, without sympathetic links. Though perhaps there's a kind of magic in that too. The quiet magic of the body's own wisdom, repairing and restoring while you dream. Good night. Let the strange remedies fade into history. Let the gemstones glitter in museum cases. Let the mandrake roots rest undisturbed in the earth. Sleep. Peacefully. Wholly. Here in this disenchanted modern world that has given you something the past could never offer. Safety from most of the things they feared, and rest without the weight of magical thinking. Sleep now. Everyday folk remedies. What regular people did. We've spent time in physicians' chambers and apothecary shops. We've seen the expensive medicines, the Theriac, the mummy powder, the precious gemstones. We've explored the learned theories, the astronomical calculations, the complex procedures that required education and wealth. But most people in the medieval world weren't wealthy, couldn't afford a university-trained physician, couldn't purchase aged Venetian Theriac or powdered ruby. When they fell ill, when they were injured, when pain struck, they had to make do with what was available, what was free or nearly free, what their mothers and grandmothers had taught them, what their neighbors knew. This is the medicine of common folk, the remedies of daily life. And they were practical in their way, resourceful, sometimes effective, sometimes harmless, and sometimes absolutely terrible ideas that probably made things worse. Let's step away from the grandeur of medical theory and into the reality of how most people actually dealt with sickness and injury. Into the world of folk remedies, passed down through generations, varying from village to village, incorporating whatever materials were at hand. And we should start with something that's going to seem shocking, disgusting even. But it was common, very common, used across cultures and centuries for all manner of ailments. Animal dung, manure, droppings, excrement. Yes, people put animal feces on their wounds and injuries. Deliberately. As medicine. Animal dung as medicine. Take a breath. Let's understand this practice, not with disgust, but with curiosity. Let's try to see it through the eyes of someone who had few other options, who was working with the materials their world provided. You're a farmer. You've cut your hand badly with a scythe while harvesting. Or you've twisted your ankle, and it's swollen and painful. Or you have an infection, a wound that's become inflamed and won't heal. You can't afford a physician. Even if you could, the nearest one might be days away in the closest town. What do? You use what you know. What your mother used, what her mother used before her. And in a farming community, in a world where animals are everywhere, where oxen plough your fields and sheep provide your wool and chickens scratch in your yard, animal dung is one of the most available substances in the world. It's everywhere, It's free. And someone generations ago noticed that sometimes when you applied it to wounds or injuries, things seemed to get better. Different animals dung for different purposes. This wasn't random. There was a whole folk taxonomy, a system of understanding which animals' droppings were best for which ailments. Cow dung was common for poultices, mixed with other substances, herbs, honey, sometimes just on its own, and applied to wounds. The theory seemed to be that it acted as a drying agent. Wounds were wet, oozing, and drying them out was considered helpful. The dung would form a kind of crust over the injury, keeping it covered, absorbing moisture. And here's the thing. Sometimes this might have actually helped, in a strange way. Not because dung has healing properties, it absolutely doesn't, but because covering a wound, even with something unsterile, was sometimes better than leaving it completely exposed to flies and dirt and further contamination. The crust formed a barrier of sorts, but often, obviously, it caused new infections. Dung is full of bacteria. Applying it to an open wound is essentially introducing a massive dose of pathogens directly into vulnerable tissue. Many wounds that might have healed on their own probably became seriously infected because of this treatment. Medieval people didn't understand bacteria, didn't know about the invisible organisms that cause infection. They only saw the visible effects. Sometimes wounds got better, sometimes they got worse, and they attributed the outcomes to other factors. The wound was too deep. The humours were too imbalanced. The stars were poorly positioned. Not that the cow dung itself was causing the problem. Horse dung was used for different purposes. Sometimes as a poultice for joint pain or arthritis. Applied warm to aching knees or hands, the warmth and the pressure of the poultice might provide some temporary relief from pain, regardless of what the poultice was made of. Pigeon dung was considered especially valuable. It was thought to have warming and dissolving properties, useful for breaking up hard swellings or tumours. Mixed with other ingredients into a paste and applied to lumps under the skin. Dog dung appears in some remedies for throat ailments. You'd see references to it in folk medicine collections, though how common the actual practice was is unclear. The historical record for folk remedies is always incomplete. These were oral traditions, practices that left little documentation. Human excrement even appears occasionally in medieval remedy books, usually for external application rather than internal use, thankfully. Sometimes mixed with other ingredients, sometimes used for its supposed drying and drawing properties. The ancient Egyptians used animal dung in their medical papyri. The Greeks and Romans referenced it. It appears in medical texts from China, India, and the Islamic world. This was a near-universal practice, which suggests, what? That people everywhere were desperate enough to try anything? That certain basic ideas about medicine, using what's available, believing that strong-smelling or unusual substances must have power, transcend cultures? By the later medieval period and into the Renaissance, learned physicians were beginning to speak against the practice. They still believed in strange remedies, still prescribed mummy powder and ground pearls, but even they thought dung was going too far. Too crude, too peasant, too likely to cause harm. But in rural areas, among people without access to professional medicine, the practice continued for centuries, well into the early modern period. Even into the 19th century in some places, you'd find farmers using cow dung poultices for wounds or swellings. It's easy to judge this harshly, to see it as ignorant, dangerous, disgusting. And it was dangerous. There's no defending it as good medicine. Many people probably died from infections introduced by dung-based treatments. But try to hold compassion alongside the judgment. These were people in pain, with limited options, doing the best they could with what they understood. They weren't trying to harm themselves. They were trying to heal, using the knowledge they had inherited, in a world that was often brutal and unforgiving. Toothache cures, animals and charms. Let's move from general wounds to a specific, terrible form of pain. One that almost everyone in the medieval world would experience at some point. one that could drive you nearly mad with suffering. Toothache. Dental care, as we know it, didn't exist. No regular brushing with effective toothpaste. No fluoride in the water. No dental cleanings or fillings. When a tooth began to decay, it would continue decaying. When an abscess formed, it would grow and fester. The pain could be extraordinary, constant, inescapable, and the treatments available were, well, let's be kind and call them creative. Some were relatively sensible. Clove oil, which actually does have numbing properties and is still used in dentistry today. Rinsing the mouth with wine or vinegar. Applying warmth to the jaw. These might provide temporary relief. But then there were the stranger remedies. The ones based not on any rational understanding of teeth or pain, but on sympathetic magic and folk belief. One common remedy involved dead mice. Yes, dead mice. For toothache. The practice varied by region, but a typical version went like this. Take a dead mouse. Sometimes it had to be a mouse that died naturally. Sometimes one you killed yourself. The details varied. And either place it directly against your cheek near the painful tooth, or wear it in a small bag around your neck. The belief was that pain could be transferred. Your tooth pain would move from your tooth into the dead mouse. The mouse would absorb the pain, draw it out of you, and you'd find relief. Did this work? Of course not. Pain doesn't transfer into dead animals. But people swore it did. They'd wear their mouse, and eventually the toothache would ease. Because toothache pain, while terrible, often comes in waves. It intensifies, then subsides, then intensifies again. If you applied your dead mouse during a bad spell, and the pain happened to ease naturally afterward, you'd credit the mouse. And the placebo effect with something this dramatic and unusual must have been significant. You're doing something weird and specific and intentional. You believe it will work. That belief itself might alter your perception of pain, might help you cope, might let you sleep when otherwise the pain would keep you awake. Frogs were used similarly. A dead frog placed in the mouth near the aching tooth, or worn in a bag. Sometimes specific instructions about what kind of frog, how it should be killed, prayers or words to say while applying it. Sometimes live frogs. You'd hold a live frog in your mouth for a period of time, letting it sit near the painful tooth. The idea was similar. The frog would absorb the pain, or some malevolent spirit causing the pain would move from you into the frog. This must have been extremely unpleasant, holding a live, struggling frog in your mouth. But if you were in enough pain, if you'd been suffering for days or weeks with a terrible toothache, you'd try almost anything. Other animal remedies for toothache included worms. Sometimes specific types of worms, found in specific places, placed on the tooth or worn in a bag. The worm would eat the pain or draw out the corrupt humor causing the ache. Spider webs, packed into a cavity in a decaying tooth. The web might actually have provided some minor protection against further irritation, acting as a kind of primitive filling, though it obviously didn't address the underlying decay. Puppy fat, the rendered fat from a young dog, warmed and applied to the jaw. The warmth might provide some comfort, regardless of its source. Eel skin, wrapped around the jaw or worn as a band around the head. The slippery, strange nature of the eel transferring to the pain, making it slip away. And then there were the charms. Words and rituals performed while applying the treatment, or sometimes instead of any physical treatment at all. You might say a specific prayer or incantation. Write certain words on a piece of paper and hold it against your cheek. Carve symbols into a piece of wood and keep it in your mouth near the tooth. Some charms invoked saints. Saint Apollonia, who was martyred by having her teeth violently extracted, became the patron saint of toothache sufferers. You'd pray to her, ask for her intercession, perhaps touch a relic or image of her while doing so. Other charms were more explicitly magical. Secret words passed down through families or communities. Formulas that had to be spoken exactly right, at the right time, facing the right direction. The words themselves would have power over the pain. There were also preventive charms. Things you'd do or carry to prevent toothache in the first place. Never use a new comb on a Friday. That would ensure toothache. Always carry a specific stone or coin. That would prevent it. Avoid eating certain foods on certain days. The list of superstitions was endless, varying by region and tradition. What's striking is how seriously people took these remedies. How much detail and specificity went into them. It wasn't just put a dead mouse on your face. It was take a mouse that died of natural causes on a Tuesday, wrap it in red cloth blessed by a priest, wear it against the left side of your jaw while facing east and saying the Lord's Prayer backward. The complexity itself suggested power. If something was that specific, that detailed, it must be important, must be effective. The difficulty of the remedy somehow validated it. And when none of this worked, when the pain became unbearable and constant, then you went to someone who would pull the tooth. Not a dentist. Those didn't exist in the modern sense. But someone with strong hands and pliers. A barber, perhaps, or a blacksmith, or just someone in the village known for tooth pulling. No anesthesia, except maybe wine or mandrake if you were lucky. Just brute force. The tooth gripped with pliers or special forceps, yanked out, taking sometimes pieces of the jaw with it. Bleeding and pain, and the hope that removing the tooth would remove the suffering. Often it did bring relief. The infected tooth gone, the constant pain source removed. But sometimes the extraction itself caused new problems. Damage to adjacent teeth. Jaw fractures. Infections in the socket. Medieval people who lived to old age often had few teeth left. Their mouths a ruin of gaps and broken stumps. These folk remedies, the dung poultices, the dead mice for toothache, they seem absurd to us now. Disgusting and ineffective. And they were ineffective, mostly. Sometimes actively harmful. But they represent something important about human nature. The need to do something when we're suffering. The need to believe that relief is possible. The need for ritual and meaning, even in something as simple as treating an injury or a toothache. These remedies gave people a sense of agency. You might be poor, you might not have access to physicians or expensive medicines, but you had knowledge. Your grandmother's remedies, your neighbor's advice, the practices of your community. You weren't helpless. You could gather cow dung for a poultice, could catch a mouse for your toothache, could say the words, perform the ritual, do the thing that might help. And sometimes, whether through coincidence or placebo effect or natural healing that would have happened anyway, it seemed to help. And that reinforced the belief, the practice, the tradition. Passed it down to the next generation, who would use it in their turn. Modern medicine has given us so much. Real anesthesia for dental work. Antibiotics for infections. Sterile technique that prevents new infections rather than causing them. We're unimaginably better off than medieval people were. But we've lost something of that communal knowledge, that sense that every household has its remedies, its traditions, its ways of coping with the body's vulnerabilities. Now when we're ill or injured, we go to professionals. We trust in science and training. And we should. That trust is well-founded. Medicine works better now than it ever has in human history. But there's a loneliness to it sometimes, a sense of passivity, of putting yourself in expert hands rather than using the knowledge of your own community, your own family line. The medieval peasant with their dung poultice was wrong about the medicine, but right about something else. That healing is something you participate in. That knowledge is passed down through generations. That remedies are acts of care, of connection to those who came before and those who will come after. As you settle into sleep, be grateful for modern dentistry, for antibiotics and antiseptics, for the fact that you'll never need to wear a dead mouse against your cheek or pack your wound with cow dung. But maybe, hold also a small appreciation for the impulse behind those remedies. The caring, the trying, the refusal to simply accept suffering without attempting relief. The methods were wrong. Terribly, sometimes fatally wrong. But the heart behind them, the desire to help, to heal, to ease pain, that was right. Has always been right. Will always be one of the better parts of human nature. Rest now. Your teeth safely cared for by fluoride and regular checkings. Your wounds, if you have any, healing cleanly without contamination. Modern and fortunate, and free from the desperate remedies of the past. Sleep. Deeply. Peacefully. While your body does its own quiet work of maintenance and repair. No mice or dung required. Good night. Protection and prevention during plague. We've talked about everyday ailments, toothaches and wounds, joint pain and headaches, the ordinary sufferings of medieval life, painful but familiar, treatable, in theory, with the remedies available, however strange or ineffective those remedies might have been. But now we need to talk about something different. Something that wasn't ordinary at all. Something that struck entire cities, entire regions, with a terror that's hard for us to fully comprehend today. Plague. The Black Death. The pestilence. The Great Mortality. Whatever name you gave it, it was the same nightmare. A disease that could kill half the people in a town within months. That struck seemingly at random, sparing some while devastating others. That caused terrible suffering, the swollen buboes, the fever, the blackening of the extremities, the painful death. The first great wave hit Europe in 1347, arriving on ships from the east, spreading along trade routes with terrifying speed. By the time it subsided around 1353, it had killed somewhere between 1/3 and 1/2 of Europe's entire population. Tens of millions of people. Gone. And it kept coming back. Smaller outbreaks, local epidemics, appearing and disappearing for centuries afterward. As late as the 1600s and 1700s, plague was still striking European cities, still killing thousands at a time. Imagine living with that knowledge, that at any time, the plague might arrive in your city. And if it did, you had maybe a 1 in 3 chance of dying. Maybe more. Your children, your spouse, your parents, any or all of them might be dead within weeks. This wasn't theoretical. This was visceral, immediate, inescapable terror. And people had no idea what caused it. No concept of bacteria or transmission vectors. They knew it spread somehow, that being near sick people seemed dangerous, that plague-stricken cities should be avoided. But the mechanism was mysterious, and the prevention was largely guesswork. Still, people tried. Of course they tried. When death is that close, that common, you'll try anything that might offer protection. Anything that might tip the odds in your favor. And so a whole array of preventive measures developed. Some based on medical theory, some on folk belief, some on desperate hope. Remedies that blurred the line between medicine and magic, between practical protection and spiritual superstition. Let's talk about two of the most famous. Two remedies that people believed, genuinely believed, might save them when plague arrived. For Thieves Vinegar and garlic. For Thieves Vinegar, there's a legend about the origin of this remedy. Like many legends, it's probably not true, but it tells us something about how people thought, what they feared, what they hoped for. The story goes like this. During one of the Great Plague outbreaks, there were 4 thieves. Some versions say they were brothers, some say just opportunistic criminals, who went through plague-stricken cities robbing the homes of the dead and dying. This was incredibly dangerous work. Everyone knew that proximity to plague victims was deadly. That's why bodies were left unburied for days, why entire households were sealed up with the sick inside, why people fled at the first sign of disease. Being near plague meant catching plague, and catching plague meant dying. And yet these 4 thieves went into the worst places, into homes where everyone was dead or dying, touched the bodies, searched for valuables, stole what they could find. And somehow they didn't get sick, didn't catch the plague, survived while all around them people were dying. Eventually they were caught, and the authorities made them a deal. Reveal your secret, tell us how you protected yourselves from the plague, and we'll spare you from execution. And the thieves revealed their recipe. A special vinegar, they said, made from specific herbs and garlic, aged and potent. They rubbed it on their bodies before entering infected houses, breathed through cloths soaked in it, drank small amounts of it, and it protected them, kept the plague at bay. That's the legend. Whether it actually happened, probably not. But the story spread, and so did the recipe. 4 Thieves Vinegar became one of the most famous plague preventatives in Europe. The actual recipe varied. Different regions, different practitioners, different traditions all had their own versions. But the basic formula was consistent. Start with strong vinegar. The strongest you could get, the most acidic. Vinegar itself was already considered protective. Its sharp smell, its preservative properties, its ability to cut through grease and dirt. To this vinegar, you'd add herbs. Lots of herbs. Different recipes called for different combinations, but common ingredients included. Garlic. Always garlic. Crushed cloves, sometimes whole heads of it, steeped in the vinegar. Garlic was considered powerfully protective, which we'll discuss more in a moment. Wormwood. Bitter and strong-smelling. Believed to ward off corruption and poison. Rue, called the herb of grace, associated with protection and purification. Lavender, fragrant and clean, thought to purify air and resist decay. Rosemary, for remembrance, but also for its sharp, clean scent that suggested health and vitality. Sage, for wisdom and healing. A powerful herb in medieval medicine. Mint, cooling and fresh. Another scent associated with cleanliness and health. Sometimes other ingredients too. Camphor, cloves, cinnamon, anything aromatic, anything with a strong clean smell that suggested the opposite of the fetid stench of plague and death. All of these would be steeped in the vinegar for days or weeks, sometimes in the sun, sometimes in a warm place, letting the herbs infuse their essences into the liquid. The resulting mixture would be dark, intensely aromatic, powerfully acidic. How was it used? Multiple ways. You could rub it on your skin, particularly on the areas of your body where plague buboes typically appeared. The neck, the armpits, the groin, creating a protective barrier, or so people believed. The sharp smell of the vinegar and herbs would repel the plague, or the miasma that carried plague, or the evil spirits that brought plague. However you understood the disease's mechanism, the Thieves Vinegar would work against it. You could soak a cloth in it and hold it over your nose and mouth when walking through plague-stricken areas, breathing through the cloth, filtering the corrupted air through the protective vinegar fumes. This is actually depicted in illustrations of plague doctors, those figures with the distinctive beaked masks. The beak was stuffed with aromatic substances, creating a primitive respirator that filtered the air they breathed. You could sprinkle it around your house, on doorways and windowsills, places where plague might enter. The vinegar creating a protective barrier, a threshold the disease couldn't cross. Some people drank small amounts of it, just a spoonful, diluted perhaps in water or wine, taking the protection internally, fortifying the body from within against plague's assault. Did it work? No, of course not. Plague is caused by the bacterium Yersinia pestis, transmitted primarily by fleas that infested rats and sometimes humans. Rubbing vinegar on your skin doesn't prevent flea bites. Breathing through vinegar-soaked cloth doesn't filter out bacteria. Drinking vinegar doesn't confer immunity. But, and this is interesting, the vinegar might have helped in indirect ways. The strong smell might have kept some insects away. Not effectively enough to prevent plague transmission, but somewhat. Any reduction in flea exposure would reduce risk, even if minimally. More importantly, the ritual of using Thieves Vinegar probably encouraged other protective behaviors. You're taking the threat seriously. You're being careful. You're probably also avoiding crowds, staying away from obviously sick people, being more conscious of hygiene and cleanliness. The vinegar itself didn't protect you, but the mindset it encouraged, the cautiousness, the awareness, the deliberate protective behaviors that might have helped at the margins. And psychologically, it gave people something to do. Some sense of control in a situation that was otherwise completely terrifying and uncontrollable. You couldn't stop plague from arriving in your city, couldn't predict who would get sick, couldn't cure it once it struck, but you could make Thieves Vinegar, could apply it carefully, could follow the ritual, and that might be enough to let you sleep at night, to let you function despite the fear, to give you some small sense that you weren't completely helpless. The remedy became so popular that it persisted long after the plague years ended. Into the 1800s and even 1900s, you could buy commercial preparations of Thieves Vinegar, not for plague anymore, but as a general disinfectant, a cleaning solution, an aromatic health tonic. And here's the fascinating part. Even though people still didn't understand germ theory, even though the original plague prevention purpose was obsolete, for Thieves Vinegar actually was somewhat effective as a disinfectant. Vinegar has mild antimicrobial properties, not strong enough to be a medical-grade disinfectant, but better than nothing. Adding herbs with their own mild antimicrobial compounds possibly helped a bit more. So the remedy, created for a purpose it couldn't serve, ended up being marginally useful for a different purpose that people didn't even understand they needed it for. There's something poetic in that. Something about human ingenuity stumbling toward effectiveness even through incorrect theories and desperate guesses. To this vinegar, you'd add herbs. Lots of herbs. Different recipes called for different combinations, but common ingredients included. Garlic. Always garlic. Crushed cloves, sometimes whole heads of it, steeped in the vinegar. Garlic was considered powerfully protective, which we'll discuss more in a moment. Wormwood. Bitter and strong smelling. Believed to ward off corruption and poison. Rue. Called the herb of grace. Associated with protection and purification. Lavender. Fragrant and clean. Thought to purify air and resist decay. Rosemary. For remembrance, but also for its sharp, clean scent that suggested health and vitality. Sage. For wisdom and healing. A powerful herb in medieval medicine. Mint. Cooling and fresh. Another scent associated with cleanliness and health. Sometimes other ingredients too. Camphor. Cloves. Cinnamon. Anything aromatic. Anything with a strong, clean smell that suggested the opposite of the fetid stench of plague and death. All of these would be steeped in the vinegar for days or weeks. Sometimes in the sun, sometimes in a warm place, letting the herbs infuse their essences into the liquid. The resulting mixture would be dark, intensely aromatic, powerfully acidic. How was it used? Multiple ways. You could rub it on your skin, particularly on the areas of your body where plague buboes typically appeared. The neck, the armpits, the groin, creating a protective barrier, or so people believed. The sharp smell of the vinegar and herbs would repel the plague, or the miasma that carried plague, or the evil spirits that brought plague. However you understood the disease's mechanism, the 4 Thieves Vinegar would work against it. You could soak a cloth in it and hold it over your nose and mouth when walking through plague-stricken areas, breathing through the cloth, filtering the corrupted air through the protective vinegar fumes. This is actually depicted in illustrations of plague doctors. Those figures with the distinctive beaked masks. The beak was stuffed with aromatic substances, creating a primitive respirator that filtered the air they breathed. You could sprinkle it around your house, on doorways and windowsills, places where plague might enter. The vinegar creating a protective barrier, a threshold the disease couldn't cross. Some people drank small amounts of it, just a spoonful, diluted perhaps in water or wine, taking the protection internally, fortifying the body from within against plague's assault. Did it work? No, of course not. Plague is caused by the bacterium Yersinia pestis, transmitted primarily by fleas that infested rats and sometimes humans. Rubbing vinegar on your skin doesn't prevent flea bites. Breathing through vinegar-soaked cloth doesn't filter out bacteria. Drinking vinegar doesn't confer immunity. But, and this is interesting, the vinegar might have helped in indirect ways. The strong smell might have kept some insects away. Not effectively enough to prevent plague transmission, but somewhat. Any reduction in flea exposure would reduce risk, even if minimally. More importantly, the ritual of using 4 Thieves Vinegar probably encouraged other protective behaviors. You're taking the threat seriously. You're being careful. You're probably also avoiding crowds, staying away from obviously sick people, being more conscious of hygiene and cleanliness. The vinegar itself didn't protect you, but the mindset it encouraged, the cautiousness, the awareness, the deliberate protective behaviors, that might have helped at the margins. And psychologically, it gave people something to do. Some sense of control in a situation that was otherwise completely terrifying and uncontrollable. You couldn't stop plague from arriving in your city, couldn't predict who would get sick, couldn't cure it once it struck, but you could make 4 Thieves Vinegar, could apply it carefully, could follow the ritual, and that might be enough to let you sleep at night, to let you function despite the fear, to give you some small sense that you weren't completely helpless. The remedy became so popular that it persisted long after the plague years ended. Into the 1800s and even 1900s, you could buy commercial preparations of 4 Thieves Vinegar, not for plague anymore, but as a general disinfectant, a cleaning solution, an aromatic health tonic. And here's the fascinating part. Even though people still didn't understand germ theory, even though the original plague prevention purpose was obsolete, for Thieves Vinegar actually was somewhat effective as a disinfectant. Vinegar has mild antimicrobial properties, not strong enough to be a medical-grade disinfectant, but better than nothing. Adding herbs with their own mild antimicrobial compounds possibly helped a bit more. So the remedy, created for a purpose it couldn't serve, ended up being marginally useful for a different purpose that people didn't even understand they needed it for. There's something poetic in that. Something about human ingenuity stumbling toward effectiveness even through incorrect theories and desperate guesses. The line between medicine and magic, between practical prevention and spiritual protection, was completely blurred. People didn't really distinguish between them. Both were types of protection. Both were necessary. You'd use 4 Thieves Vinegar and wear a garlic amulet and pray to Saint Sebastian and avoid crowds and burn aromatic herbs in your house. You'd do everything. Because why take chances? Why rely on just one method when you could use many? The stakes were too high. Death was too close. And community practices emerged too. Not just individual protections, but collective rituals. Whole neighborhoods might gather to burn aromatic materials in the streets. Great bonfires of rosemary and lavender, sage and juniper. The smoke rising to purify the air over the entire area. Everyone contributing what herbs they had. Everyone breathing the fragrant smoke, hoping it would protect them all. Churches would ring bells constantly during plague times. The sound waves were thought to break up and disperse the corrupted air, to shake loose the miasma clinging to the city. Processions of flagellants would march through streets, whipping themselves, performing acts of penance, trying to appease God's wrath, to show sufficient contrition that the plague might be lifted. All of it was about agency, about doing something, anything, rather than passively waiting to see if death would come for you and your family. None of these protections worked. The plague killed rich and poor, pious and sinful, those who wore garlic and those who didn't. It killed arbitrarily, as bacterial diseases do, based on exposure and immune response and chance, not on virtue or preventive measures or prayers. But the people trying these protections didn't know that. Couldn't know that. They saw some people survive and others die, and they looked for patterns, for explanations, for anything that might give them an edge. And in the absence of real knowledge, they created systems. Systems that made sense within their worldview, that gave meaning to the chaos, that let them feel like participants in their own survival rather than helpless victims. As you lie here in the dark, safe from plague, living in an age where that disease is controllable and rare, take a moment to appreciate what you've been spared. The terror of seeing plague approach your city, the desperate crafting of amulets, the garlic everywhere, the vinegar-soaked cloths, the prayers and processions, and the knowledge that none of it might matter, that you might still wake up with a fever, might still find the dreaded swelling in your neck or armpit, might still die within days despite everything you'd done to protect yourself. Medieval people lived with that fear for generations. Centuries of recurring plague, of never knowing when it might return, of always carrying that background anxiety. And they faced it with remarkable courage, with ingenuity, with determination to survive. The remedies might not have worked, but the impulse behind them, the refusal to give up, the insistence on trying, on protecting, on caring for each other, that was noble, genuinely noble. Rest now. Breathe deeply. The air around you is clean, free from miasma, both real and imagined. No garlic needed around your neck. No vinegar-soaked cloth required to filter your breath. You live in a safer world than they could have dreamed of. A world where plague is rare and treatable, where the diseases that killed them by millions are now preventable or curable. Sleep safely in that knowledge. Let the plague years recede into history. Let the desperate remedies fade into interesting stories, nothing more. You are protected, not by garlic or vinegar or amulets, but by centuries of accumulated medical knowledge, by antibiotics and vaccines, by understanding of disease that those medieval people would have thought miraculous. Sleep, deeply, peacefully, free from the terror that haunted their nights. Good night. The plague will not come. Not for you. Not tonight. Not ever, most likely. Rest in that security. That precious, hard-won security that human knowledge has finally achieved. Sleep. The twist ending. When medieval medicine was right. We've traveled through the strange landscape of medieval and ancient medicine together, through the theory of humours and the careful examination of urine, through bloodletting and trepanation, through Theriac with its 70 ingredients and mummy powder scraped from ancient tombs. We've seen mandrake roots that supposedly screamed, weapons treated instead of wounds, gemstones ground to powder and consumed, cow dung applied to injuries, dead mice for toothache, garlic and vinegar against the plague. And throughout this journey, there's been an underlying assumption, an assumption we've both been making, probably without even noticing it. The assumption that all of this was, well, wrong, misguided, the product of ignorance and superstition. Interesting as history, perhaps touching in its desperation, but fundamentally mistaken about how the body works and how healing happens. Medieval medicine was primitive, we think, ineffective, sometimes actively harmful. We've moved beyond all that into real medicine, scientific medicine, medicine that actually works. And mostly that's true. Most medieval remedies didn't work. Many made things worse. The theoretical framework of humoral medicine was incorrect. The belief in sympathetic magic and astrological influences was unfounded. But, there's a but. What if I told you that modern scientists, using advanced laboratory techniques and rigorous testing protocols, have discovered that at least one medieval remedy, one specific, strange, carefully detailed recipe from over 1,000 years ago, actually works? Not as placebo, not as gentle relief, not as marginally better than nothing, but actually works, genuinely, powerfully, against one of the most dangerous bacteria facing modern medicine. Let me tell you about Bald's Leech Book, and about a recipe that has stunned microbiologists and medical historians alike. Bald's Leech Book. The year is approximately 900 AD. We're in Anglo-Saxon England, centuries before the high medieval period, even further from the Renaissance. This is early medieval medicine, older than most of the practices we've discussed. Someone, we don't know exactly who, though the manuscript is dedicated to or owned by someone named Bald, is compiling a medical text. A leech book. Leech being the Anglo-Saxon word for physician, nothing to do with the blood-sucking creatures. This leech book contains remedies for various ailments. Many of them are what you'd expect. Herbal preparations, prayers and charms, treatments based on the medical understanding of the time, much of it inherited from Greek and Roman sources, mixed with local folk knowledge. Most of it is, well, it's typical medieval medicine. Some of it might have helped marginally. Some of it was probably useless. Some of it was likely harmful. But there's one remedy, one specific recipe, for eye infections, and the recipe is detailed, precise, more like a modern pharmaceutical preparation protocol than like most medieval recipes, which tend to be vague about quantities and methods. Here's what it says, translated from the Old English. Take crop leek, that's a type of onion or leek, and garlic, both in equal amounts. Pound them well together. Take wine and bullock's gall, that's ox bile, in equal amounts. Mix them together. Put the pounded onion and garlic into this liquid mixture. Let it stand in a brass vessel for 9 nights. Strain it through a cloth. Strain it well, removing all solid particles. Apply the liquid to the eyes with a feather. That's it. That's the recipe. Specific ingredients in specific proportions, prepared in a specific way, aged for a specific time in a specific type of container. For over 1,000 years, this recipe sat in the manuscript, copied by scribes, studied by historians, catalogued in libraries. Interesting as a historical artifact, but just another medieval remedy. Another example of the strange things people used to do. Until 2015. The modern discovery. A team of researchers at the University of Nottingham, led by microbiologist Dr. Freya Harrison and medievalist Dr. Christina Lee, decided to do something unusual. Instead of just reading about medieval remedies, they wanted to test one, to actually make it according to the medieval recipe and see what happened. They chose the eye remedy from Bald's Leech Book partly because the recipe was so detailed, so precise. They could actually follow it, could recreate it accurately. They gathered their ingredients. Onion and garlic from a grocery store. Not exactly the same varieties as Anglo-Saxon England would have had, but close enough. Wine. fresh ox bile from a butcher, a brass vessel. They followed the recipe exactly. Pounded the onion and garlic together. Mixed them with wine and bile. Put the mixture in a brass container. Left it for 9 nights, 9 days, at room temperature. After 9 days, they strained it carefully through a cloth, just as the instructions specified. What they had was a golden greenish liquid. It smelled. Well, it smelled like you'd expect a mixture of aged onion, garlic, wine, and bile to smell. Not pleasant. But that wasn't the point. The point was, does it do anything? They tested it against bacteria. Multiple types of bacteria, including some that are particularly problematic for modern medicine. And the results were extraordinary. The remedy was effective against several bacterial species. But most remarkably, most shockingly, it was highly effective against MRSA, methicillin-resistant Staphylococcus aureus. MRSA is one of the superbugs, one of the antibiotic-resistant bacteria that terrify modern doctors. It causes serious infections, particularly in hospitals and healthcare settings. Skin infections, blood infections, pneumonia. And it's resistant to most standard antibiotics. It's difficult to treat, and it kills thousands of people every year. Modern medicine struggles with MRSA. We have antibiotics that work against it, but they're powerful drugs with significant side effects, and the bacteria is evolving resistance even to those. And here was this 1,000-year-old recipe, made from ingredients you could buy at a grocery store and a butcher shop, killing MRSA in laboratory tests. Not just inhibiting its growth, killing it, reducing MRSA biofilms, the protective community's bacteria form that are especially hard to treat, by up to 90% in some tests. The researchers were astonished. They repeated the experiments, tested it multiple times, multiple ways, brought in other laboratories to verify the results. It kept working. They also tested the individual ingredients. Maybe it was just the garlic, which is known to have some antimicrobial properties, or just the wine, which is acidic, or just the bile. But no. The individual ingredients, tested separately, had much weaker effects. Some antimicrobial activity, yes, but nothing like the complete remedy. It was the combination that mattered. The specific ingredients in the specific proportions, prepared in the specific way, aged in brass for 9 days. Something about that process, perhaps the chemical reactions between the ingredients, perhaps the compounds leaching from the brass vessel, perhaps something else they don't fully understand yet, created a substance with genuine antibiotic properties. An antibiotic created by someone in Anglo-Saxon England, over 1,000 years before the discovery of penicillin, centuries before germ theory, in an age when people didn't even know bacteria existed. What this means? Let that settle in your mind as you lie there in the dark. Someone in the year 900, working without microscopes or laboratories or any understanding of microbiology, developed a remedy that can kill one of the most dangerous bacteria facing 21st century medicine. How? We don't fully know. We may never know exactly how this recipe was developed. Maybe it was systematic experimentation. Someone trying different combinations of ingredients, different preparation methods, observing which ones seem to work best for eye infections. Trial and error over years, maybe generations, gradually refining the recipe. Maybe it was lucky accident. Someone happened to store onion and garlic in brass with wine and bile, noticed it had interesting properties, found it helped with infections. Maybe there was more sophistication to early medieval medicine than we've given it credit for. Maybe there were empirical traditions, careful observation, genuine proto-scientific methods that we've dismissed because the theoretical framework surrounding them was wrong. Probably all of the above. Probably this recipe represents accumulated knowledge, refined over time, preserved because it worked even though the people using it didn't understand why. And here's the thing that should make us pause, should make us reconsider our dismissive attitude toward all medieval medicine. If one remedy works, genuinely, provably, scientifically works, what else might we have overlooked? How many other recipes are sitting in medieval manuscripts, untested by modern methods, assumed to be useless because they come from a pre-scientific age? The researchers at Nottingham have started testing other remedies from Bald's Leech Book and from other medieval sources. They found a few more that show antimicrobial activity, though none as dramatic as the eye remedy so far. But they've barely scratched the surface. There are hundreds of medieval medical texts, thousands of recipes. Most have never been subjected to rigorous scientific testing. We've assumed they don't work because the theory behind them was wrong, because humoral medicine was wrong, because medieval people didn't understand disease the way we do. But what if effectiveness doesn't require correct theory? What if empirical observation, this works even though we don't know why, is enough to develop real treatments? Traditional Chinese medicine uses remedies that work, that have genuine pharmacological activity, even though the theoretical framework of qi and meridians isn't scientifically accurate. Indigenous peoples around the world developed effective medicines, like aspirin from willow bark, quinine from cinchona bark, digitalis from foxglove, through careful observation and accumulated knowledge, not through modern scientific method. Why should medieval European medicine be different? Why assume it's all useless just because the underlying theory was wrong? Maybe there are more effective remedies buried in those old texts, waiting to be tested, waiting to be rediscovered. Maybe the medieval physicians, for all their mistakes and their incorrect theories, were better observers than we've given them credit for. Maybe they noticed what worked and preserved it, even when they couldn't explain it. The eye remedy from Bald's Leech Book is now being studied for potential development into a modern antibiotic. The researchers are trying to understand exactly how it works, what compounds are responsible for its effectiveness, whether it can be refined and standardized for medical use. We might end up with a new weapon against MRSA, developed from a 1,000-year-old recipe. Medieval medicine contributing to modern healthcare in a direct, practical, life-saving way. Reframing the story. So now we have to reconsider everything we've talked about tonight. Yes, most medieval medicine didn't work. Yes, the theoretical framework was wrong. Yes, many treatments were harmful. But we can't dismiss it all as ignorant superstition anymore. Can't treat it as nothing more than a cautionary tale about the bad old days before science. Because woven through all that incorrect theory, all those ineffective remedies, all those strange and sometimes harmful practices, there were threads of real knowledge, real effectiveness, real healing that worked for reasons the practitioners didn't understand, but had learned to recognize through careful observation. The medieval physician who prescribed the eye remedy from Bald's Leech Book didn't know about bacteria, didn't understand antibiotics, couldn't have explained why the remedy worked. But they knew it did work, had observed it working, had recorded the recipe precisely so others could use it too. That's not ignorance. That's practical wisdom. That's empirical knowledge, the foundation on which all science is eventually built. And maybe we should approach the rest of medieval medicine with a bit more humility, a bit more curiosity. Instead of assuming we know it's all useless, maybe we should test more of it. Study it. See what other surprises might be waiting. Not because we should go back to bloodletting and trepanation. Not because humoral theory was right. But because human beings have been trying to heal each other for thousands of years. And sometimes they figured things out that we've forgotten or never knew. The past might have more to teach us than we thought. As you drift into sleep now, let this reframe everything you've heard tonight. All those strange remedies, all those desperate attempts at healing, they weren't just foolishness. They were human ingenuity, human caring, human determination to reduce suffering and preserve life. Most of them didn't work, but some of them did, and we're only beginning to discover which ones. The medieval world was stranger than we can easily imagine, darker in many ways, more dangerous, more painful, shorter lives filled with more suffering, but also more resilient than we give it credit for, more knowledgeable in ways we haven't recognized, more connected to empirical reality, even through the lens of incorrect theory. Those physicians examining urine, consulting the stars, preparing their complex remedies, they were trying, observing, learning, passing knowledge down through generations, sometimes getting it wrong, but sometimes stumbling onto something real. And that 1,000-year-old recipe for eye infections, now being studied in modern laboratories, killing bacteria that resist our best modern antibiotics. That's their legacy. That's the proof that medieval medicine wasn't all darkness and error. There was light there too, knowledge there too, healing there too. Rest now. Let your eyes close. Those same eyes that medieval physicians tried to heal with their brass-aged remedy, not knowing why it worked, only that it did. Sleep deeply. Dream of continuity, not just change. Of threads connecting past to present, ancient wisdom to modern science, medieval healers to contemporary researchers. We stand on their shoulders, even when we don't realize it, even when we think we've left them behind completely. The story of medicine isn't a simple progression from ignorance to knowledge. It's more complicated, more interesting, more humbling than that. Sometimes the ancients knew things we're only now rediscovering. Sometimes the answer we need was written down 1,000 years ago, waiting patiently for us to take it seriously enough to test it. Good night. Sleep well. And maybe approach history with a little more wonder, a little more respect, a little more openness to being surprised. The past has secrets still, lessons unlearned, knowledge waiting to be found again. Rest. Dream. Let the centuries blur together. Let the strange become familiar, the familiar strange. And sleep, finally, deeply, knowing that the human drive to heal, to help, to care for each other, that hasn't changed. Not in 1,000 years. Not ever. That's been constant, from the first healer to the last. From Anglo-Saxon England to modern laboratories. From their world to ours. Sleep now. In that continuity. In that long, unbroken chain of human compassion stretching across all the centuries. Good night.